Thank you. Good evening and welcome. We are going to call to order the regular meeting for the Akron Public Schools Board of Education for Monday, July 13th to order. Roll call, please.
Dr. Akbar.
Here.
Mr. Alexander.
Present.
Ms. Autry.
Present.
Mr. Bravo.
Present.
Dr. Hall.
Aye.
Mrs. Mansfield.
Here.
Mrs. McKittrick. Mrs. McKittrick.
Here.
Thank you.
Okay, and if everyone could mute, we will take care of the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much. At this time, we are going to open it up for community and school reflections. I will keep an eye on the chat, or if you happen to have your camera on, I will also try and see if you raise your hand. So we'll open it up right now. Ms. McKittrick, if you would like to get us started, please.
Thank you. Good evening, everyone. First, I'd like to express my condolences to the family and friends of Jaden Shipp, who would have been an incoming senior this year, and he lost his fight with cancer, so my deepest sympathies to his family. Second, I would like to thank the parents, family members, faculty, staff, etc., who've reached out to me and given input regarding reopening the 2021 school year. I really appreciate and value your opinions. And as we navigate how best to reopen, I would like everyone to remember that the word unprecedented has been used repeatedly to characterize this pandemic. And therefore, the way we've always done things won't necessarily work. And we have to evaluate, and in some cases, perhaps reevaluate all of our options when deciding how best to educate our children so that their health, the health of their families, the faculty, staff, and administration all remain our priority. Thank you.
Thank you, Ms. McKittrick. Would someone else like to go next? And a couple of the cameras on my end are stuck, and I'm not sure if that's just me or so if you could put it in the chat just in case. Dr. Akbar?
Yes. Thank you very much, Patrick. I think what Val shared, Ms. McKittrick shared earlier is spot on. I'll add that, we've all received multiple emails and even phone calls about reopening, and we know that you have concerns, and I think that everybody involved has concerns as well, and so there's never going to be I don't think we're going to get a situation where everyone will be happy, but I just want to say that my priority is to ensure everything that Valerie said, but also to make sure that we're taking everything into consideration and knowing that this is it's just a difficult decision all around moving forward. One that none of us probably thought we would ever have to make, but we're definitely not making it lightly, whatever we end up doing. We're not making it today, but just wanted to share that.
Thank you, Dr. Akbar. Would anyone else like to go next? Ms. Mansfield?
Hi, everyone. I don't know that I can say it better than my two colleagues, but I do just want to talk a little bit about how much we would love to return to school of last year, of yesterday, of normalcy. And that's the piece that we all crave in all of our lives right now, is normalcy. And school, the way it was normal. And so when I hear people say children need socialization, children need stability, we want to be able to give them all of those things as well. But what we all need to strive for is finding what that next normal is together. And it's hard. It's hard to give up on what we had. And I'm not saying we can't all, go back to that at some point, but that normalcy and making things feel as normal as possible, as a staff, as administration, as parents, as a community, and normalizing as much as we can so that our kids feel safe in whatever situation that we're in. So thanks to our colleagues for how they stated it. Also, Valerie mentioned the young man who passed, and I also wanted to give a shout out to the folks that went and painted the stone at Firestone in his honor. What a way that has been used to allow us to mourn during this unusual time, and also to honor some folks. So thanks to them for their hard work.
Thank you, Ms. Mansfield. Anyone else? Ms. Autry?
Yeah, just very briefly, I also just wanted to concur with what my colleagues have just shared, and just to acknowledge as well the many folks who took the time to reach out to me and the other board members to share their thoughts and concerns. And again, just wanted to acknowledge them, that they've been heard, and that we're working hard for the safety and what's best for all of our staff and families and students involved. And I would like to just reserve the rest of my time and comments for the end of the agenda, when we'll go into more.
Thank you, Ms. Autry. Dr. Hall?
Yeah, thanks, Mr. President. I will also concur with the earlier conveyed sentiments of my colleagues, and just add a couple of things. I think at times in the past, it has been a challenge to articulate the value proposition of what a robust public education system brings to our community. And I think what we've really heard over the last several months, and really especially the last couple of weeks since the presentation of that sort of initial draft plan, is multiple parents and teachers and families articulating in a plethora of ways that very same value proposition. And so while there are very few silver linings in some of these dark clouds, I would say, and would suggest and submit to all of you, that one of those silver linings is that we have again sort of found our calling in this storm. And so I know that there's a lot of work that has been done. There's still a lot of work to be done, but I could not imagine a better group of folks to do that work with. And so, having said that, I will, much like Ms. Autry, I will reserve the rest of my comments for the discussion on the reopening plan update. Thank you.
Thank you, Dr. Hall. Anyone else? Okay. I'm going to give just a few comments now so that I can get through the president's report later. We'll just kind of, I'll gloss over that a little bit, because I really want to save time for the discussion on the reopening. And I know that a lot of you would like to share some comments and feedback and things that you've been receiving from the public. So first, let me say thank you to our superintendent and his staff, to our treasurer and his staff, to our union leadership and their members for really doing a yeoman's job in working on this reopening plan. I know it's not perfect yet, and as has been stated earlier, we're not making any decision tonight. It's a plan that continues to evolve and change as we continue to receive guidance and updates from local, state, and national authorities and medical and public health professionals and the community itself. But you guys have put in so much work, and we really appreciate that. We know how difficult this is. This board is faced with making some of the most difficult decisions it's made in recent history, and it's one of those times where when we get it right, we're not necessarily going to be celebrating if we get it wrong. We're really going to get it wrong. We have so many interests, competing interests in some cases, to balance the health and safety of our kids, the health and safety of our staff, the need for our kids to continue making progress. There's so much to consider here. And I hope that the community knows and can feel that we are moving forward in a very thoughtful and deliberate way. And we are really taking our time on this, even though we don't have a lot of time to spare. But we are really trying to make thoughtful decisions. And so we really appreciate, again, all of the folks that have reached out to us through email, by phone call, through the website. Please know that you can reach us in any number of ways. Our phone numbers, our email addresses are listed on the APS, our akronschools.com website. So please reach out to us and share your feedback. We've received a lot of that, and thank you to the board members who have responded and copied some of our colleagues so that we can see some of the feedback. For the board members too, we're going to be coming up with a way where you can start sharing some of that feedback with the rest of the group so that we can all keep it in one place too as you continue to get some feedback. And we can get you some answers that everyone can also see then, in case they're getting some of the same questions. We have a lot going on outside of the reopening plan. And so just a couple of things I'll mention. You all should have received some emails regarding the superintendent and treasurer evaluations. So you'll get the most recent evaluation as well as a copy of the blank evaluation. And during new business, we'll talk about those a little bit. And if you have any questions, we'll walk through some of that. And then we still, you should have also gotten some emails checking your availability for board retreat. Obviously, we're a little behind where we wanted to be with the board retreat, but we've also been trying to allow the staff to keep their focus where it should be, which is on the reopening plan. So if you get a chance and you haven't responded to those emails yet, please check those emails and let us know what your availability is in August for the board retreat. If there are no more community and school reflections, then we will move on. We have no requests to address the board. We have no recognitions or communications this evening. So hearing nothing else, we do have a need to approve meeting minutes from the special meeting from June 19th, the regular meeting from June 22nd, and the two special meetings from June 29th and July 1st. Do we have a motion for approval of those meeting minutes?
So moved.
Second.
Thank you, Ms. Autry, Ms. Mansfield. We have a motion and a second. Are there any comments, question, or discussion on the meeting minutes? Hearing none, roll call, please.
Mrs. Mansfield,
Yes.
Mrs. McKittrick,
Yes.
Dr. Akbar,
Yes.
Mr. Alexander,
Yes.
Ms. Autry,
Yes.
Mr. Bravo,
Yes.
Dr. Hall.
Aye.
Thank you.
Thank you so much. Superintendent's recommendations, personnel. Mr. Superintendent, you're muted.
Sorry. I wish to recommend approval of the personnel recommendations presented in categories 5 through 16. Also in category 16, I regret to report the death of Mr. Frank Krichovic, who was a consulting teacher in teaching and learning, who passed away on Friday, July 3rd. He was an employee of the Akron Board of Education for 20 years. And also, I regret to report the death of Mrs. Joanne Nauer, who was a secondary LRC technician at Firestone and Litchfield COCs, who passed away on Thursday, July 9th. And she was an employee of APS for 40 years.
Thank you. And certainly our thoughts and prayers go out to their family members. Do we have a motion on the personnel recommendations?
So moved.
Second.
Thank you. A first motion by Ms. Autry, a second by Ms. Mansfield. Are there any comments, questions, or discussion on the personnel recommendation? Hearing none, roll call, please.
Mrs. McKittrick,
Yes.
Dr. Akbar,
Yes.
Mr. Alexander,
Yes, abstain from 5.8.
thank you. Ms. Autry,
Yes.
Mr. Bravo,
Aye.
Dr. Hall,
Aye.
Mrs. Mansfield,
Yes.
thank you.
Next, Mr. President, I wish to recommend approval of the resolutions and motions presented in category 21.
Thank you. Do we have a motion on the consent agenda items?
So moved.
Thank you. We have a motion by Ms. McKittrick, a second by Dr. Akbar. Are there any comments, questions, or discussion on the consent agenda items? Hearing none, roll call, please.
Dr. Akbar,
Yes.
Mr. Alexander,
Yes.
Ms. Autry,
Yes.
Mr. Bravo,
Yes.
Dr. Hall,
Aye.
Mrs. Mansfield,
Yes.
Mrs. McKittrick,
Yes.
thank you.
And finally, Mr. President, I wish to recommend approval of the business affairs recommendations presented in category 23.
Thank you. Do we have a motion on the business affairs agenda items?
So moved.
Second.
Thank you. A motion by Dr. Akbar, a second by Ms. McKittrick. Are there any comments, questions, or discussion on business affairs? Hearing and seeing none, roll call, please.
Mr. Alexander,
Yes.
Ms. Autry,
Yes.
Mr. Bravo,
Yes.
Dr. Hall,
Aye.
Mrs. Mansfield,
Yes.
Mrs. McKittrick,
Yes.
Dr. Akbar,
Yes.
thank you.
Thank you. Superintendent's report.
I'll reserve my time under unfinished business.
Thank you. I'll also be reserving the balance of my time on the president's report for comments on the reopening discussion. Treasurer's report.
Just a reminder that our finance committee meeting is scheduled for next Monday. We are likely to repost that as a special board meeting. Invite all to attend to have further discussion regarding upcoming operating levy.
Thank you
Thank
so much. Committee reports, legal contracts, and board policy.
Yes, the Legal Contracts and Policy Committee, we met on July the 6th, and we had several board members present. We had Dr. Akbar, President Bravo, Valerie McKittrick, Dr. Hall, Mr. Pendleton, Ms. Fido, and myself. And we discussed, actually, we kind of briefly discussed a couple top discussion topics, which was a second reading of our policy of purchases and policy procurement, federal grants funds. We discussed that, and we are going to move forward with that. Actually, it's going to be presented today. Also, we talked about authorization of accepting distribution of electronic records, which will be also hopefully approved today. And there was some discussion under that, which Mrs. Fido did present some information to the committee that some of the big eight had went with some of the Neola, what Neola reported, and a handful of them adopted what the Neola had presented. And a couple of those districts were like Columbus and Youngstown. So they did adopt that, and we will hear more. We'll hopefully have that approved also today. We also talked about our naming policy, and the naming policy is something we had out for a little while, and we are looking to hopefully have that taken care of no later than January 1 of this year. There was some discussion in reference to some more issues that we think we need to, or areas we need to comment on, maybe get cleared up before we move forward with that. But that will be hopefully done by January 1, if not before. And then we had a real rich discussion on proposed racial equity policy, which was a policy that we are talking about writing. And there was a lot of good discussion. Ms. Fido had brought up some information about the Big 8 and the urban districts, OSBA, and some of the things that some of those individuals are doing. But there are also some of the members of the committee as well as the board who had received information from other school districts in reference to what they're looking at and what their equity policies. And some of the better policies that came from like Jefferson County and Louisville, Kentucky, St. Paul, and Seattle, who had a lot of good things going with their racial equity policy. And so we're looking at hopefully moving that forward in our next committee meeting to look at more what we need to do and develop and get that ready for future for us to deal with in the future. We also had where a couple of other districts also had some policies like the racial equity policies as well that I think that will be good for us to look at. Like it's in Texas and Virginia. And this is a summary of what we also did. We completed the second reading of our policies, which was mentioned. We have additional research to do on the naming policy. Just a few things there, which was mentioned. We have some good suggestions as well. We should move forward again, as mentioned, with the equity policy. And we also discussed, which I think is good, because also with our equity policy, just like the racial equity policy, you have a committee, and we talked about maybe putting together a committee because there's a lot of recommendations where the committees are there in all these other districts, and where you would have some people from the school, you would have people from the community, you would have other individuals and as far as administration who would be there, and the teachers union as well, who would be a team of people to make sure that we are following the guidelines, and they will be monitoring and reporting out on that policy as well. So we hope that we will have this ready, hopefully in a few months, that we can probably, maybe even before then, that we can bring something to the board, let board members look at it and make suggestions or changes that they may think would be wise for us to have, and then we will move forward from there. Dr. Akbar, if I missed anything, can you get it? Thank you.
Yes, no problem. Thank you very much. I think Bruce mentioned everything as far as the meeting. And so today we are presenting to you for a third reading the policy on purchasing, policy 6320, policy 6325 on procurement and federal grants and funds, as well as third reading for policy 6107, authorization to accept and distribute electronic records and use of electronic signatures. Those three policies are before you for a third and final reading and for a vote.
Thank you, Dr. Akbar. You have the policies as mentioned on your agenda. Do we have a motion for the approval and adoption of those policies as listed in the agenda?
So move.
Second.
Thank you. We have a motion by Mr. Alexander and a second by Ms. McKittrick. Any final comments, questions, or discussion on those three policies? Hearing and seeing none, roll call, please.
Ms. Autry,
Yes.
Mr. Bravo,
Yes.
Dr. Hall,
Aye.
Mrs. Mansfield,
Yeah.
Mrs. McKittrick,
Yes.
Dr. Akbar,
Yes.
Mr. Alexander.
Yes.
Thank you.
Thank you. Finance and Capital Management Committee.
Thank you, Mr. President. We have nothing to report this time. I think Mr. Pendleton laid out what our plan of action was going to be for the in the forthcoming week. Thank you.
Thank you so much. Instructional policy and student achievement.
Yes, we had a phone call this past week, and most of the conversation centered on the reopening plan, which we're going to get to soon. So I'll just leave it at that. Thank you.
Thank you so much. Ms. Mansfield.
Yes, thank you. Real quick, just wanted to thank Dr. McWilliams-Woods for taking all of our concerns forward and for giving us answers where she could as we're trying to go through this plan. Also, listening to all the hard work of the Legal and Policy Committee reminded me of something I forgot to mention earlier. I wanted to again thank that committee and Dr. Akbar for their work on our resolution on racism as a public health crisis, and acknowledge the fact that Hudson School Board has reached out for some of that work as well. And Dr. Akbar has very graciously offered his assistance in that. And they're also interested in some cross work with our district going forward. And I'll be talking to you, Mr. President, about that if we can going forward. Also, one other thing I neglected to mention was the work of First Serve over at North High School. I got to meet the head of that. Her name's Susan, and I can't for the life remember her last name right this moment, but they're doing volunteer work over at North despite COVID and despite all of, they're doing it with social distancing. They're doing it in an incredibly safe manner. So it's taking them all summer to do the work, but just a huge thanks to them and also to the Hudson School Board for reaching out. It was very appreciated.
Thank you, Ms. Mansfield. With that, we're going to head into new business, and we're going to receive an update on the reopening plan for Akron Public Schools. And as Ms. McKittrick said earlier, very perfectly, we are certainly in unprecedented times. Many of you know that we were hoping to have a plan in place for this meeting that we would be adopting. And unfortunately, so many circumstances have changed recently. So instead, we are going to provide an update. And I'd really like to open it up to the board for some conversation and for some feedback to share what you're hearing from the community. So with that, we're going to turn it over to Dr. James. And we'll get started. Thank you.
All right, thank you. You're absolutely right with some of the guidance documents that we were eagerly awaiting last week. Our committee, chaired by Pat Shipe and Dr. McWilliams-Woods, they're going to go through where we are today, and there'll be several instances in the presentation and even after where we would like your input. So I'll turn it over to Pat Shipe and Dr. McWilliams-Woods.
Thank you very much, Dr. James and Board President and Vice President. We are, Pat Shipe and I are glad to be back again to give you an update. I think the pacing of how we've brought this to the board was kind of an interesting time frame on how we brought the recommendations actually before the state had released their guidance. And now we've been able to absorb that, come back, share an update tonight, and then look at the next board meeting for final approval. So tonight, we're not going to go through, obviously the comprehensive plan and all the recommendations we did last time. We're going to just hone in on some key decision points tonight, remind you what our recommendations are. A lot hasn't changed too much from the last board meeting when we shared. I think mostly what has happened is we've been reinforced that our planning and our direction was very solid, and we've just reinforced our recommendations, and we'll share those tonight. Obviously, every decision we're making is based on our district focus. to keep the momentum going, particularly our College and Career Academy transformation. And we'll talk a little bit about that tonight as well. The changes that have happened since we presented to you on the 29th, on the left of the screen, the reset and restart guidelines came from the Department of Education, and we have poured through those. And for the most part, all of the planning that because we based it on draft guidelines, we're really aligned with what came out in terms of the final guidelines. There weren't very many surprises whatsoever because they stayed pretty consistent with where they were headed with the draft guidelines. The second thing that has come out since the 29th is the governor and the Ohio Department of Health released, which is the middle document, the K-12 schools reopening guidance. And again, we poured through that. Fortunately, because of our superintendent's close connection with both the governor and the state superintendent and serving on advisories for both, we really were able to get kind of a front row seat on a lot of the changes that were coming. So again, not a lot of surprises, not a lot of additional information. We'll show you where there were a few nuances, but I think it just reinforced our plan. What we've done since the 29th is we have worked very closely with our key partners from the Summit County Public Health and then our own Akron Children's Hospital, who supports all of our health clinics throughout the school district. We've worked with them, kind of digested the guidance, and we'll show you those updates tonight. The other big thing that has happened since we met on the 29th, as you all know, that Summit County moved from a level 2 to a level 3 based on the data indicators that the state has set up in terms of risk factors. So again, similar to the guidance, this is just one thing that reinforced our recommendations and I think solidified our plan and our update for you tonight. These were the key health advisory recommendations that we shared with you last time. And for the most part, these stayed similar in terms of what the Department of Health put out and the Ohio Department of Education. The plans talk more about, instead of a rigid 6 feet of social distance, they talk about maintaining social distance. We will, I think it's important for you all to know that on a call last week with all the administrators in Summit County Public Health did say that they could support plans that went down to 3 feet of social distance if all of these other health things were in place, like masks and things like that. So you may hear some districts talk about that. Tonight, we are still here talking to you about staying in line with what the governor, what the CDC, the Center for Disease Control, that optimally, and Summit County Public Health did say on the call that they think, the safest distance is that 6 feet. And so we're here tonight to continue to reinforce that as part of our plan. And I'll talk about that when we look at the models again. The other things were the capacity on the bus. The 50%, the way that has changed from last time till now is just maintaining social distance on the bus. We do know that the Summit County Public Health would support, with many health conditions kind of in place, would support having 2 students per bus with masks and with lots of other health conditions. So when we were here on the 29th, it was sort of looking more like a strict 50% capacity. Now there is some flexibility, but you would have to have lots of other health conditions on place. So we'll talk to you tonight about kind of the decision point that you'll need to make at our next board meeting around transportation. The face masks we'll talk about tonight as well. And then the health assessments, how we're going to be doing that process of health assessments is a decision point. And then our sanitation and large group gatherings was pretty consistent. One other thing that we are prepared for, and we wanted to go through tonight's board meeting and then tomorrow finalize plans. We put together a website that will communicate to our parents and our families and our students on everything to do with reopening. And it takes all the recommendations from our reopening and recovery team and puts it in kind of organized around key areas. I apologize. The reopening website has information around 8 of the key reopening areas, like the extracurriculars, the athletics, how we're going to do child nutrition. And those are all areas that we can go ahead and start communicating, because those are things that really aren't going to change, especially the health sanitation, how we're going to sanitize, have kids wash their hands before they eat. There's some key things that no matter how we reopen, no matter what model we use, they're going to be consistent. And we feel like it's time to start communicating that out to families so that they can see that even before the next board meeting. And I'd like to show you, let me see if I can get this. It's looking like my hyperlink, there it goes. It wasn't working right away, but I'll show you. This is what the website is going to look like with an opening letter. For right now, we've got key terms for reopening, and eventually this place will be where the school models will go once you make decisions at our next board meeting. And then we talk about all of the health and safety and logistics. So when this goes live, probably tomorrow or the next day, parents can come and click on here to see exactly what are the safety provisions, for example, that no matter how we open, we're going to have in place. So the cleaning regimen, the physical routine changes, how we'll be assessing symptoms, things like that, that are not going to change. And there's things for mental health support. How are we going to support that? And it's organized in a way where we've listed everything that we know up here, what we know. And then if there's anything that we have yet to determine, it's listed down at the bottom. So each of the areas, so families can start to get the understanding, see how are we going to deal with meals. This is all the way the meal service will be provided. And then there's a few things that we still have to determine. And then that will change. We'll keep updating it. And then we'll update it when you make the major decisions in terms of the reopening. Any questions just about that website?
I do have one question. Yes. Yeah, I do have a question.
Yes.
I was just looking to ask, when is the date in the date when we're going to possibly roll this out, and how are we going to get people or drive people to the website? What is the marketing plan to get people driven to the website, to parents, community, to get to the website to see what's going on so they understand what's happening before they get their kids in school?
That's an excellent question, because we can post things on the website, right? But if nobody knows they're there and we don't drive people there, we actually have a team that has mapped out, it's almost a day by day kind of outreach plan with emails, with social media contacts, with all calls where this will be announced so that everybody can start to drive to it. Once the real important work, this is all just the background type things that isn't going to change, that everybody is interested at least to start to understand what's going to be in place, especially health and safety things that I think are at top of mind for all families and for staff. But the second piece, which is the most important, is what are the models going to look like, and the key decision points that we'll go over tonight. That will also be loaded, and we'll do another wave of communication to families to say, now go and look, because now it's time that you're going to have to actually make a selection, and there will be support for families on how they make a selection. There's a frequently asked questions section on the website. When families are making the actual selection of whether they want to go 100% remote with their students or whether they want to have a site-based blended option, we're actually going to have a live chat feature so that as parents are filling out the form to indicate one or the other, there will be someone live that can answer any questions that they have as they're actually making that selection. So we're going to kind of flood lots of support, lots of frequently asked questions. There's a help desk, phone call that people can make. I mean, we'll be very responsive in that way.
Okay, and I want to also ask, when people look at the website and they read and find out what's going on, if they have questions, will there be a phone number, or will there be an email address where they can type in their questions they have after reading this? Because I know there are going to be some people who will have questions. So when they read it,
yes, as soon as it goes live, there is there's a button that you can just click that takes you to how you can ask a question and get a response. And someone will be monitoring that every hour of the day as people, so that they can, if they leave their phone number, someone will call them right away, or they'll just answer their question via email. There'll be both options.
Yes, because some people may not have, like we know some of the students and parents don't have, social media and don't have access to internet, so they would need another way, maybe possibly to call.
And the all calls, when we can make the all calls for the families, that will help too. And our principals will be able to push it out through their normal means of communication.
Okay, thank you.
Mm-hmm.
I have a comment or question.
Yes.
So I think it would be helpful with that if when folks had questions that they were posted as well, so that folks can look and see, their question might have been asked already. If we had a running list of questions, I think that might be helpful.
Yeah, we've started, there's I think 5 questions posted right now. So we have right next to where families can ask questions, there's a frequently asked questions section that you can click, and you can see all the types of questions that people have been asking. And so the good thing is, whenever they click to go talk to somebody, we'll be able to capture those questions and then just keep loading more and more questions and answers on the frequently asked question section of the website.
Other questions or comments on the website piece? Okay.
So the rest of the update tonight is really honed in on the 6 key decision points that the board have by, I put July 20th because that's what is tentatively been talked about it for the next meeting. And obviously if that changes, we'll adjust that. But there are 6 out of all of the reopening pieces and all the recommendations that we've provided. It really comes down to these 6 kind of big blocks. The first one obviously is the school models, the 100% remote and a blended option, and then K2 being full-time. That decision by our next meeting will be obviously that'll be the top decision needed to be made next time. The second decision is the grade levels for face coverings, and we'll talk about the face coverings and what our recommendation is. The governor's plan and the Department of Health's plan strongly suggested face coverings for all grade levels, and the governor actually answered this question in the press conference that he felt like all grade levels could wear them, but they put in the plan recommendation for at least 3rd grade through 12th grade. So we'll talk about our recommendation tonight. The third thing is the number of students on a bus and making that final decision of options, and we'll show you those options tonight. This is a new item tonight that came up since the last time we were together, whether we should waive uniforms, the uniform requirement just for this year. It has come up in questions from parents, and then it's also came up from our principals, and we'll talk about our recommendation regarding uniforms. The 5th decision point is whether to add staff prep days in August to give us more days to prepare for all of the routines that we're going to have to be shifting in our buildings and the health items and preparing remote lessons. So we have a recommendation tonight for that. And then the last item is the student and staff health check procedures. And so we'll talk about what kind of decisions will need to be made regarding that. So 6 areas, and that's what we're going to step through each one of those. So decision number 1 is the school models.
Hold on for 1 second. It looks like Mr. Akbar got disconnected.
Yes, let's pause for just a minute.
Okay.
I'm going to shoot him a text just in case.
Mr. President, Dr. Akbar is trying to work on getting logged back in.
Thank you. All right, we have Dr. Akbar back. Dr. Akbar, can you let us know, did you miss anything on the previous slide?
Yeah, the last thing Ellen was saying was face coverings and deciding what grade level, and then life kind of ended after that.
Okay. I'll go ahead and recap the other items in this list of 6 decision points for the board. The third one is the number of students on a bus, and we'll talk about each one of these in subsequent slides. The 4th decision point is whether to waive uniforms, and this is a new item that didn't come up as part of our recommendations on the 29th. But there have been a number of questions from parents and a recommendation from our principals and grades K through 8 regarding uniforms, and we'll talk about that tonight. And then item 5 is whether to add staff prep days in August to provide additional support to create all of the new routines that we're going to have to create in our schools and to prepare all the remote lessons, and we'll show you what that would look like. And then the last decision point is student and staff health check procedures on how we're going to actually do the kind of the symptom monitoring and health checks in our schools. So we'll talk through each one of these tonight. So the first decision is the school models, and we're here tonight to continue our recommendation that we made last time. Nothing has shifted us off the recommendation that we really, as I said last meeting, there really are only 3 options for reopening school. Either you're 100% remote, you're doing some type of blended model, or you're 100% site-based. We actually have incorporated all 3 of these into our plan, depending on the grade level. And I'll show you, I'll just refresh your memory just kind of quickly through the models. And then I know there's been the most questions about high school, so Mark Black and I will talk more about the high school option. One thing just to remember, that when you're looking at the site-based any site-based model, which would be bringing kids back 100% of the time or doing some blended, the key is that if you're going to follow the CDC recommendations, the Department of Health, the Ohio Department of Health recommendations, that 6 feet is the optimal in terms of maintaining that social distance. It really does take a class and splits it basically in half, almost a little bit less than half. And that consideration of that 6 feet of social distancing, we're continuing tonight to recommend that we maintain that. I think moving to the level red and the governor's and the state advisory just reinforces that even more. So the way that we laid out the models last time, just a quick summary, and then if you have questions specifically about one, we can dive in once we go through these. The preschool model is really basically the same exact model that they already have, because they already are 5 days a week, half-day sessions. The class size is a little bit reduced from more like 12 kids down to 9 students. The elementary model for K2, we're prioritizing K2 because of the need for that strong early intervention in those early years that impact, as Mary Otley Kelly always says, they're the foundation. And if you don't get that right, then it cascades all through your upper grades. And so this is the 100% site-based, but splitting a class into 2 locations so that we're keeping that reduced class size. It'll be around 12 students per classroom, so that the students can go 5 days a week. And that continues to be our recommendation tonight. In grades 3-5, we're recommending what a number of districts are doing. When we look at our other urban brothers and sisters, I know Canton has presented tonight more of a staggered schedule like this. Toledo is also discussing, I think tonight, the same type of staggered schedule. Columbus and Cincinnati have similar models as this as well, where in grades 3-5, 2 days per week would be site-based and 3 days per week would be remote. And that way you're splitting kids in half to keep the class size reduced. So half of the kids go 2 days, half of the students go the next 2 days, and then there would be one day where the teachers would be able to facilitate remote learning for the entire class. The middle school is 2 days per week, site-based, similar to the grades 3-5, and 3 days remote, same concept. You're taking what would typically be a class of, probably around 30 students, and you're splitting it down so that students have, half of the students are coming 2 days, then half of the students come another different 2 days. So you're basically splitting them in half. The high school model is, and I want to say this is the most innovative, out of the box, flipped kind of classroom model that I think I've seen any district do yet. And so we're going to spend a little more time on this because I know there's been the most questions around this. But the basic framework is that by academy, the teachers are looking at the projects within the courses within their academy and mapping out a schedule for the students to come in so that they're prioritizing the projects, the labs, the discussion groups, all of the most hands-on kind of the college and career academy aspect of our learning, instead of coming in as soon as you do what we just talked about with 3rd through 8th grade. If you're having students come in on a set schedule just for the seat time, you're really reducing the amount of instruction that can happen because half of the kids are coming 2 days, half of the kids are coming 2 days, and that same teacher is teaching that next group. The way that the academy teachers want to be able to look uniquely at the courses that they're offering and map out a schedule. And Mr. Black will go into more detail about what that schedule looks like so that families will know in advance, they'll know the days the students are coming in, but it will give the flexibility to be able to focus more on the hands-on projects versus just trying to count minutes of seat time. So let's dive a little deeper. These are the most common questions that came from board members related to this high school model, and we wanted to pause a little bit and spend more time. So I'm going to turn it over to Mark to answer the two kind of biggest common questions as I was talking to board members or via discussions that we all have had in senior staff, hearing from other people what the most common questions, and then we can open it up to questions. We'll kind of pause with the high school reopening to hear questions. So go ahead, Mr. Black.
Good evening. One of the most asked questions, not just from the board, but also from parents who have called my office and our principals at the high school level, was around, will they have a semester schedule or a quarter schedule? Semester being for half of the year, for 2 quarters, and then a quarter schedule, of course, for the first 9 weeks, then a reevaluation period, and another schedule goes out to the students. The schedules will be designed quarterly with 2 weeks of flexible rotations to support enrichment and intervention. And what that means is each student will have designated day when they're coming to the building, but the teachers will have the opportunity to bring the students to the building more based on their progress through the rotations or sessions rather that they would go through for the first 2 weeks. The learning experience will consist of remote and on-site for each week, with students attending 1 to 3 days a week within a cohort group. The one thing that we all have to understand is this remote learning does not look like what we did 4th quarter, because our teachers are at the building, they're planning, collaborating, and able to work with students and families remotely and face-to-face. So that's the first thing we have to understand. The second one is, when we did this in the 4th quarter, we had students that were completing college credit plus courses. Now we will be starting the school year where they will have some college credit plus courses and some courses at the building. So when we say 1 to 3 days a week, that means a student may report to the high school 1 day a week, but they may be going to the University of Akron, Stark State for the other days within that week. So we had to take in consideration all of our students within this plan. The groups will be based on academy, grade level, and the courses that they're taking, such as AP, CCP, IB, if I'm in the arts program, things of that nature. Provided with the relevant learning experience, and uphold the safety of each child and allow for contact tracing if needed, so that you know the cohorts that your child has been rotating with, as well as the school buildings will know what cohorts the students were a part of. So they will be assigned to them strategically. The other question is, why are high school students on a different schedule than middle school? Again, our high school students are on a schedule based on their trajectory towards graduation, as well as the other courses that they have taken on, whether it's a CCP course, whether they're in the IB program, the AP program, a CTE program. We have a more complex schedule than a middle schooler will have, which means more time for our students to follow the portrait of a graduate, where they will have to identify challenges, where they will have to show that they can collaborate, where they will have to show that they have strong habits of mind. Because as you guys know, our goal is to make sure students are ready for college, career, and life. And we know that at the college level, this blended flipped learning model exists, as well as within some of their daily jobs that they will have to take on. So our number one goal is to ensure that our students graduate high school and uphold their portrait of a graduate. And through this flipped learning, we'll be able to do that by front loading the work. When they're at home working remotely, the work will be front loaded. So when they come to face-to-face sessions at the high school, they're not getting lectured. They're doing more of the real world experiences and collaboration, so that they can show what they learned at home remotely, they can turn into a product within the school day when they're face to face with the teacher. So students will have an opportunity for enrichment and intervention and supports in their AP classes, because we still have an AP test that we have to prepare students for. We still have IB commitments that we have, as well as CTE credentials and electives that students will need for graduation. And the time spent will be similar to the time spent in grades 3 through 8, just designed differently. As Dr. McWilliams-Woods said, it's a more innovative organization of how students can get learning, but also how students can demonstrate that they learned in real time while they're face-to-face with their teachers.
So just to summarize those key concepts then, so students and families will have a schedule where they'll know which days the students, the academy, which days are assigned to that academy. And they'll know that by the entire quarter, they'll know that. And students will have that opportunity at least once a week, that they'll be site-based, having based on the academy teachers designing. The flexibility is more what they do when they come versus the time. So they'll be at least that one day a week, but there will be more opportunities to get to 2 or 3 days depending on the courses. And what's so unique, if you think, I use this phrase all the time, that really what we've designed with our high schools is more like a college type schedule. The college and career academies is designed more like students having a major, students having specific courses. And so our approach this year has to fit that each course is going to be unique in terms of whether it should be site-based, what content should be remote, how much time they're going to need for site-based versus remote. We much rather design that course by course, but the families will know ahead of time, here's the days assigned to this academy, so that families can plan and know ahead of time. And then the flexibility is if a course requires some additional time to prep for the AP class, or to some additional intervention needed for math, the teacher can always add more time then for a student to come in based on that, the uniqueness of that course and the uniqueness of the student. Okay, I'm going to pause because we are at the last part of the school models. So to summarize, just in terms of the models, what we're recommending tonight is the same recommendations that Pat and I brought on the 29th. Everything just reinforced that this is the right direction and we're on the right track. We're trying to give you more detail about the high school model, since that's where most of the questions came in. And I just want to say this because I think this is going to be what's going to happen the next week or two, is there will be some schools in this county that are going to go back full-time with 3 feet of social distancing and try to have all their kids go back at the same time. And we're hearing that some schools, it may be some private schools, it may be some of the surrounding schools in the county. We have talked a lot since the 29th, how we feel about that. Where do we fit in that world? And we have come out of all of that discussion with the confirmation that when you look at the safety of our students, when you look at the safety of our staff, and all of you know, and we talked about last time, the staff really have the greater risk in terms of the data. When you look at the staff safety, when we look at our ability as a district to provide the academic supports and the remote learning opportunities because of the infrastructure that the board has created over these years, we really feel like this is the best option. These different models depending on the grade level. The other thing that I just want to say, and then we'll open it up to questions just on the school models, is the other things that come into play that do make us unique. And this isn't unique that no other districts experience this, but this is unique in terms of when we look at the Akron Public Schools as a whole, why this may be the best decision. We do have to acknowledge and understand that because of a higher low-income population, the access to quality health care is an issue. We know that. We know the racial disparities of health conditions, and we see the different rates of incidence of COVID and how it is inequitable in terms of the spread in minority communities. And that's an issue that's a long issue because it goes back to health equity issues to begin with. And our racial justice statements have talked specifically about that. But we do have to acknowledge that that is a unique issue for us, as well as our other urban brothers and sisters. But we need to keep that in front of us as we make this decision. We also have our students, because of those inequities, we also have increased health issues. Our children struggle with more health issues. That's why we have such a great partnership with Children's Hospital to provide the supports that we need for our students. One example of that, when we're talking about a respiratory disease that is spreading, we have 2,300 students who have asthma in our district. And so when you think about that and you think about the other conditions like diabetes and the other major underlying conditions, we have over 100 other respiratory diseases and diabetes that students are grappling with. Those are the types of data points that we have to keep in front of us when we're making the decision versus looking at what other districts or other counties are doing. The other major data points are when you're watching the Summit County Health Department, the greater spread that's happening in our refugee populations, which primarily is our North Hill area. The rate is much higher there than it should be based on the percentage of the population. And the same thing I already mentioned, the race inequities in the Black population because of all those longstanding health issues. So again, we have to take that into consideration. That makes us unique. The other thing is increased transportation. We are transporting more kids than most districts, particularly in this region. And that we have to then, that is another factor that we have to think about on how we're getting kids to school and how can we do that safely. And then the last thing is just being in proximity in a city environment. We're all closer together just as we're leaving when you're going home versus some of the other areas. So when you think of all those factors, that just reinforces our recommendations tonight. So now questions just on the school models before we hop to the other areas.
Yeah, thank you. As we open it up, thank you, Dr. Hall. I see you jumping in line as well. I've got some folks, we'll go in order that people have been letting me know that they have comments. And as we look at all of these models, I'm really interested to hear from other board members. I'm struggling in my own heart. I guess I want to know that we're making the right decision, and not just the right decision for our students, but as you've stated, the right decision for our staff. I'd love to hear more as we continue these discussions, to hear more about the safety of our staff and what that looks like, because there's certainly a lot of concern there. And I think for as much as the feedback we've continued to receive from parents and community members about the safety of our students and what reopening looks like for them, I want to make sure that we're all having a thoughtful conversation about what that looks like for our staff as well. With that being said, on the school model, I'd like to open it up. Ms. Mansfield, Dr. Akbar, Mr. Alexander, and then Dr. Hall. So Ms. Mansfield, if you want to start.
Sorry about that glitch there. Oh gosh, there's so much. So I just want to go back to my original question. But before I do that, I just want to thank Dr. McWilliams-Woods for reminding us and reminding the city that we are unique in Summit County. And as these other districts make their announcement, there's a reason why the governor is letting us have local control over this. And we have to do what's right for Akron, not what's right for Cuyahoga Falls or Springfield. And so thank you so much for bringing that up and bringing up the healthcare disparities, because I think that is going to be a highly overlooked piece of this. Getting back to, because I could go so many different directions with this, I just want to go back to my original question. Ellen, could you bring up the slide of the 3rd through 8th grade? I just wanted to see if you could highlight just a little bit. You did such a great job of explaining the high school model this time around that I feel like I have a much better grasp of that. Could you just highlight the 3 through 8 model? It had something about the details for what those remote days look like that I thought we should really focus on for families, because I think there's this idea that they're in school 2 days and then they're just going to be sitting at home. And Mr. Black also pointed out that this is not what we did in the 4th quarter. But can you just kind of highlight that part, just put a little emphasis on that for us?
Absolutely. So the way that the remote days will look like, there's actually 3 remote days when you think of 3 through 8, because kids are 2 days site-based, then the other half come 2 days, and then there's 1 day left in the week. One question that came up that I might as well just answer now as part of this is we've had the question, well, why don't you have the kids on the 2 days when they're off? Why don't you have them pipe into the class so that they can actually be watching it at least? But you do have to realize that what's happening is the teachers are replicating what's happening. So you're doing 2 days. So say, for example, 2 kids come Monday, or half of the kids come Monday, Wednesday, and they're getting a lesson on the rotation of the earth, okay? And then the next half come in on the other 2 days, on Tuesday, Thursday, and they get the same exact lesson. So the kids would be coming in and piping into the same exact lesson if we were to just videotape the teacher doing the lesson. So what will need to be designed, which is why one of the reasons why we're adding days at the beginning of the year, is on the remote days, the teachers will have posted assignments, projects, lessons in their Google Classrooms for kids to go do during those 2 self-directed remote days. And they'll be, they could be hands-on activities that the kids take from when they're in school. They may take a project home to work on it. They might have to build something at home during those 2 days. So it doesn't all have to be technology. That's why we use the term remote. It doesn't mean digital always, because it could just be assignments that the teachers give them to do on those next 2 days. The other thing that on these, and I'll call them just to help you understand, the self-directed remote days. those 2 days, the other thing that that we're working on with our community partners is we're working with some of our college and career academy partners to create some virtual experiences that we would also just build into our curriculum. We're doing that at the elementary level with our essential learning experience, same partners like the Art Museum, the zoo, Stan Hewitt, and we're working with them to create virtual lessons so that we're not losing those essential experiences that we had. And we're gonna do the same thing at the middle school with more of a college and career academy flair, that those also would be assigned on those days that are the self-directed days, that they may be piped in with a virtual community partner, learning something that is aligned with our curriculum. And then on that 5th day, that's a facilitated remote day. So now the teacher is going to be with both groups of kids, their whole class, and doing a remote lessons during that day so that all the students will be able to pipe in. That's where there'll be Google Meets, where they'll be doing classroom work together.
Thank you for that. I think that that's an important piece that we were missing. So I'm so excited to hear those details. I think that that'll give a lot of comfort to our parents, not thinking that it's just, it has much more meat on the bones of what we've gotten before. So thank you.
Yeah, and I also want Mark, Mr. Black mentioned this also, but what we did, and we kind of make the distinction between what we did in the spring was sort of the emergency remote learning. You know, on a dime in 1.3 seconds, we had to flip the district to this remote learning. And we did, you know, the parents weren't prepared for that. The students, you know, had to just quickly, within 24 hours, all of a sudden you're remote. This, we call it APS Connected Learning 2.0, you know, is what this remote learning 2.0, there's going to be some different expectations in terms of the student engagement and the student connecting in to those Google Meets when the teachers have those. These essential experiences and community-based experiences, you know, that is a 2.0. That's a higher level of expectation for the students during the remote time. So I think all the families and the students should anticipate that, which is why we're asking for those additional days to make sure we have time at the beginning of the year to get everything prepped and prepared and to prepare our families.
Thank you so much. Dr. Akbar and then Mr. Alexander.
Yes. So Mark Black mentioned the project-based learning once a week for high school students, and then the possibility that there could be multiple other days, up to 3 days a week for students. I just wonder, when you think about that, and I think it was described like a college campus. I think Ellen mentioned that. But I wonder, when you think about that and you think about the fact that our high schoolers are minors, and the risks that are involved in that, how are we how do we manage that? So, you know, you have students who may have, so you get your schedule, you know, you have 1 day a week on at the building, but then, you know, you are in certain classes that are adding 1 or 2 days a week, and they're only there for that one class. So I'm assuming then they would need to leave after that. So like, how are we managing that and making sure that what if a student doesn't show up that day, with, you know, how we normally do all calls, that would be harder to manage. And so I wonder if we've thought about that.
I'll let Mr. Black answer the high school questions.
So thank you, Dr. Akbar. We will have structures in place for the students so the parents know the days that they're going there. So when you saw the 2-week flexibility, the students will have to commit to their schedules for that 2 weeks. And then before the 2 weeks is up, they're told that it'll be extended for another 2 weeks, or they'll go to another class. The one thing we got to remember is all of our students at the high school level and middle school level, they have 6 classes that they follow, some up to 8. They will still follow those classes. It's just that the design of how they follow them will be different. So the schedule that they have is the schedule that they'll keep. So if I got math in the morning, English after that, social studies, those classes aren't fading away. And again, we got to get out of the model of what we had at the fourth quarter and know that when the students are working at home remotely, they're following their schedules independently, the independent schedule that they have. When they come to the building for that day, they're still following all of those classes. So it's not a drop in and leave out, okay? There will be a designated time when they officially leave, and that's still in discussion. But it's not a drop in for one period and then I leave. When they come, they will be there for the duration of that day, getting the supports that they need. Because the cohorts that we're creating, again, the trajectory towards graduation. If I'm off track from graduation, then I know that I'm going to be there 2 to 3 days a week, all day. If I'm on track for graduation, but I'm having trouble with my AP test, I scored a 1 on the last AP test, my goal is to score 3, I'm going to be there for that AP class and my other classes for that whole entire day. Okay. So it's not a, I'm coming for one period at 8:30 to 9:30 and leaving, right? Although we do have that happen in a traditional school setting now. So, our students are already asked to do that in some cases because they'll come in for a post-secondary class or a CCP course, and then they'll leave and they'll go home, for the day.
Yeah, I want to reinforce that we're not talking about creating a college campus type environment. We're not talking about this willy-nilly free, moving. We're talking about kids will have schedules. They will know when they're coming. Parents will know they're coming, and that'll be a set time designated by each of the academies. So that will be very clear. This additional support or the additional enrichment will be unique to the course, so that if it is an intervention type course, the students may be scheduled, but they'll still get the schedule. They'll know that they're supposed to come a second additional time for that additional intervention. Or if it's an enrichment type, an AP class that they need some additional AP test prep, I think I mentioned before, then they would come in for that. But parents will know that ahead of time, and they'll have a schedule. I think once we start mocking up specific schedules so that everybody can see how this is going to work and what it's going to look like, I think that it will help kind of create the image of, oh, I see. Now I know I'm going to know exactly when my kid is reporting to school, and I'm going to know what the course schedule is, because it's going to be the same type of schedule that they're getting right now. Here's the typical course schedule. Here's when the remote courses will be. Here's when the face-to-face time will be.
Okay. I guess what I'm struggling with is the part where you're saying that if they need the extra support or what have you for the extra days. So if I'm hearing you correctly, if one of or two of their courses are saying everyone in Academy A will be here on Mondays, but then two of their courses are saying, okay, one course says I need you here on Wednesday, another course says we need you here on Thursday. If they come on the Wednesday and the Thursday, you're saying that they're still going to do their classes. They're going to go do their work in those classes that day because they're there for the extra day for whatever that class is. So let's say Academy A, maybe 30% of their students are here as well on their day and another day. Is that what you're saying?
Mr. Black, I'll keep letting you answer all the questions.
Yes, remember, we're having them travel by cohort. So if my day is Monday to be there for my collaborative learning, to have my face-to-face with my full schedule with my teachers, then that cohort group, that teacher will know that they only can come back on, let's say, Wednesday. So they'll come back Wednesday, and the teachers would know that that cohort of group is in the building on Wednesday, and they're able to go through all the courses they need support, as well as they can check in for that online learning support as well. So in that document, it talks about the core online support. So the academy can design that schedule, the teachers, the team of teachers for that student for that day.
Okay. So I don't know if you answered my question. So I'm just specifically trying to get an answer to my question. So if there's an extra day, are you saying everyone in the cohort is doing the extra day if needed, or you're just saying the specific students that are being requested to do the extra day for whatever the reasons are doing the extra day? I don't think that's an answer.
Yeah, the teachers are assigning the students based on how they feel they're progressing in their work online and in their work in their collaborative PBLs. So yes, they're requesting the students to be there based on their progress. The students aren't mandated, but that's the day that is dedicated for them to be brought in if they need to be brought in.
And all of that is done ahead of time and communicated that this is the group that we know is going to need additional support. So their schedule will look different than the next one, or it's a cohort that's going to be a part of some enrichment higher level courses that are going to need, or lab courses that will need additional time. So that's where the cohorts will be established, and then they'll know the schedule ahead of time, that they come in on their regular Monday, but then they also come in on Wednesdays during this block of time within that quarter.
Okay.
These are all great questions, and these are all the questions, you know, that we know that families have as well. So keep asking.
Yeah, I just want to get clarity, and then I'll back up and let, I think, Mr. Alexander's next. So what you just said is what I believe you said is what I stated earlier. They're only coming on that second day for a certain block of time, and they won't be there the whole day.
The block of time that they come will fulfill the same day if they would come on their scheduled day. So we're not, I don't know if this has been discussed yet, Dr. McWilliams-Woods, about the time. So maybe that's what's confusing, you know, Dr. Akbar. Have the times been discussed yet?
Yeah, we haven't talked about the way the courses will lay out. The discussion has been is that the core classes will take priority right now versus some of the electives. So we'll make sure that like all the core courses will be blocked in the afternoon, for example. Once the academy teams map out their schedules, we'll say, let's prioritize those to make sure that when kids are coming in and if they need additional intervention for math, and they're there in that afternoon. And again, parents would know this way ahead of time. They would know, here's the schedule. And then the kids, then if they have sports or extracurriculars, they would stay for the rest of the afternoon then. And we are thinking prioritizing those core classes in the afternoon is what teacher said, because that's where the kids are the best equipped for core courses, and the electives could be in the morning time.
Okay,
So,
thank you.
So Dr. Akbar, off of that, if I'm set to come in for that extra day on Wednesday in the morning, I'm gonna meet with my elective teachers because I may have band and choir, or I may have AP art. So that's my opportunity to get my extra help with my elective teachers. And then in the afternoon, I'm gonna go with my core teachers who feel that I need the extra help as well, because there's not gonna be enough time in one day for me as an AP art teacher to get everything that my student needs to them. So they, you know, if they're behind, so they got to come back and they'll do that in the morning, and then in the afternoon they could work on their course. So all of the teachers know that I have access to you on that day for you to get some extra learning.
Okay, I think if you just sent us a draft of the planned schedule, it would make sense because it's not making sense.
Yeah,
When we
and we
get there-
have
when we
the
get there,
team.
we'll-
The team is working on that actively. They met this afternoon to start to mock up different schedules. So we'll get that to you by the middle of this next week so you can start to see how this, and we'll just have you like follow some students through the schedule. I know we are, this model, we are pushing for innovation. We're pushing, this is not a model where we're saying we don't want high school students to be in a site-based setting. That is not what this is about. This is a complete opposite, where we have been in this more inquiry-based, hands-on, project-based mode. So let's keep doing that, and let's make sure that we're providing the academic supports for students, but we're tailoring it to course by course by course by course, instead of kind of the old school notion that everybody else is doing, where you just come to school on 2 days per week. Because as soon as you do that, remember what I said in grades 3 through 8, the teachers are then repeating those lessons. So now you are not getting that other instruction those other 2 days. And then there's a facilitated remote option. For high school students, every course is so unique. It's unique in terms of how hands-on it should be, whether it could be remote, and every academy is now very unique based on our college and career pathways embedded in that. So what we're saying is we will have a schedule where families will know exactly what days a week the kids need to come in. But what we're doing is handing to the academy teachers, you all design what makes sense in terms of the content, the projects, how you may want to collaborate across subjects to work on a project, and make it unique to each academy. The parents will know what day a week the student is supposed to come in, and whether there's those additional support sessions or that additional enrichment time. They will know that ahead of time. But we believe that this kind of flipped classroom concept, where the core kind of content can be remote, and then you're prioritizing coming in to do projects, that is where it's at to support our college and career academies. I know we're pushing the envelope in innovation. I know we're challenging you to think out of the box in terms of how to bring students in rather than the 2 days a week, just kind of set schedule. And I think the disadvantages, we don't have all the schedules to start showing you yet, but we'll get those to you the middle of the week. As long as you say tonight, keep working and keep moving in this direction, and then we can give you another update next Monday.
Okay. Mr. Alexander?
Oh, uh-oh. Okay. Can you hear me?
Yes. And then Dr. Hall.
I was going to pass, but since you got me here, I'll go ahead and do it because I know there's other questions, and mine is basically more or less of a comment. And I want to say, as Ms. Mansfield mentioned earlier, Akron Public Schools is unique, and what we have to understand, there's no cookie cutter fit for any school district, but all the school districts across the state and across the United States is different. And so we're going to be looking at different plans. I do like our options because we're given options, and we have to think about the teaching and the learning, which I understand, and that's very important. But I also want to think about the safety, because if you don't have the safety piece in there, there's not going to be any education, teaching, and learning going on. So we have to think about that safety piece as well. And when we mentioned Dr. McWilliams-Woods about some of these other districts, these smaller districts doing the social distancing of a couple feet and so forth, we have to understand that some of these schools, a lot of these school districts we're talking about are much smaller than Akron Public Schools. And we're a medium-sized school district, basically. And we have to look at the numbers that we have. And so our numbers are a lot larger than some of these smaller schools. So there are some things they're going to be able to do in their school districts that we won't not be able to do due to the number of kids that we have and due to the number of kids that they have in their district as well. So I just want everybody to understand it is going to be unique. This is not going to be the same type of education that we've been looking at for a number of years. And we're going to have to also get ready to understand and be ready that this may be the norm as we move forward. It may not be the old way of education. This might be a new way. So we need to get ready and prepare for that. And I think we're moving in the right direction. So thank you.
Thank you, Mr. Alexander. Dr. Hall?
Yeah, thank you, Mr. President. I have several questions, but I'll lead with a couple comments first. Number one, as folks who are elected by the community, we as board members have a certain obligation to ensure that we're getting answers to questions that our constituents are asking of us, demanding of us. So please know that as we sort of walk through the rest of this presentation tonight, that I've endeavored or am endeavoring to ensure that I ask as many of those questions as possible. My second general comment before I sort of start asking questions with respect to the models is regarding, I think we threw out July 20th as a possible date, to approve a plan. And let me be very candid and frank. I don't believe that we have done enough yet to message, engage the community about this plan. And so now I'm not here to lay blame on the folks in this call, because part of it, is, we also need our parents and other folks to engage us as well. But as Mr. Alexander just pointed out, we are a much larger district, and therefore it might take a little more time to ensure that we're getting appropriate community and stakeholder feedback before we make an attempt to approve a plan in just 7 days. So regardless of how perfect the plan is or isn't, right? So I just want to feel like as a community elected official that we've done all that we can to ensure that we're getting feedback from as many sort of rank and file teachers, parents, caregivers that we can. So and again, and I remain skeptical that we can do that in 6 days. So those are my sort of first two comments. Number three, I would echo Mr. Bravo's comments around our teachers. We talked about a lot about student safety. I am very concerned about teacher safety. And so we know that if you look at sort of national data, and we have our own data as well, but we know that there's a significant percentage of our teachers who are going to fall in that at-risk age, in those at-risk age groups. And so a lot of the questions I've been asked from teachers are, and we can answer these later on, but I just want to sort of tease you with these. But questions such as, if I get sick from COVID, can I file for workman's comp? If I get sick from COVID and what do my healthcare benefits look like? As far as the usage of my sick days and whatnot. If I'm a teacher and a loved one is high risk, and they get seriously ill, who's covering their healthcare costs, right? So there are a lot of questions. As we talk through these models, I guess a question I have is, can we staff these models? Because I've heard from a lot of teachers who are very unsure about whether they are going to come back and teach in person. So insofar as we're trying to offer some in-person teaching, are we confident that we can staff that? Do we have data? And we do. I would love to see it, but do we have data that would suggest that the majority of our teachers want to be back and are available to teach in person? And if teachers make a decision, that they don't want to, come back in person, how does that impact their teaching assignments? So and their placement within their buildings and their standing. So I have a lot of questions about how we're caring for our teachers. And but I'm not asking for answers for those right now. I'm just sort of that's my teaser. But my first question with respect to the model is in thinking about that K through 2. I tell you, out of all the age groups that I've gotten, that I've heard from the third grade group, like more than any other group besides high school. I've heard from teachers. Last count, I've heard from 11 teachers of third graders. Yes, I'm keeping count. 11 teachers of third graders, that have articulated their concerns about the challenged reading ability of a number of our students and how this model sort of allows them to progress. There's a lot of skepticism about, is this going to help those kids, really get to where they need from a reading comprehension standpoint? And and there were questions around, well, why was the cut point second grade? So that's my first question, right? Why did we cut it at second grade? Why didn't we include third grade in there as far as that everyday school? Is kind of the first sort of packaged question that I'd like to ask.
Well, Dr. Hall, you're showcasing why our district is so incredible because of extraordinary educators who are asking those questions and who care about our third grade students advancing academically. And one of the other great things about our district, but it also then we have to make that consideration in terms of safety, is that we also don't have the kind of rampant turnover that a lot of urban districts have, which means we have some great solid veteran staff, but also that puts them at that risk factor that Mr. Alexander was talking about. So the K2, we did model out including third grade, and that in this model with the K2, the 100% site-based, we really worked very hard to try to see if we could do it. What happens when you remember how we're going to do this model is you have one class and we split the class into 2 classrooms. So right away you have to realize we have to double the number of classrooms in the city, like physical classrooms in the city. And then we have to make sure we have the staff then to cover both classrooms. So while the core teacher is teaching the math and English to half of the class, the other class is getting some art, music, their intervention specialists may be coming in and working with a group of kids in that other half. And then the teacher switches. Then the teacher goes in the afternoon and teaches the other. So you've got to have more staff because basically we're in essence almost doubling our staff coverage because you're splitting the kids into 2 classrooms, and you have to have the space. We did the analysis of K2 and looked at all of the space utilization across the city. And then of course, Mary Opley Kelly said, we've got to do grade 3. And our teacher teams, the teachers on our team said, we've got to pick up grade 3. And so we ran the numbers, and that's where space was becoming more significant of an issue in multiple clusters, and the numbers of staff needed to support it. We just didn't feel like we could get there. So it was kind of a double. We were already going to be stretched with K2, but to add grade 3, it didn't look like we would be able to have the number of classrooms we would need across the city and the staff to be able to cover it. If you are maintaining the 6 feet in social distancing, I have to make sure you understand that, because once you do the 6 feet of social distancing, then it splits the class in half, basically.
Thank you. So, and I remain a staunch advocate of the 6 feet spacing differential. So I know that there was some language around this 3 feet, but if you go back and actually read the American Academy of Pediatrics guidelines around that, they were talking about 3 to 6 feet may approximate a similar benefit. Didn't say it would or shall approximate a similar benefit. So again, I think it's so again so the folks who in other districts that have reached out, I've talked to, I pointed that out to them as well. It's important to actually read the guideline and not oversimplify it. My second question then is so in the K through 3 model, I guess it's 3 through 5. I'm sorry, 3 through 5 next, if you want to go to that slide. We talked about how we're splitting the class days, right? So 2 days, half the class is in, 2 days, other half of the classes, but then there's 3 days of remote learning. So if I'm a student, and again, this is a question, I'm again channeling constituent questions here, right? So if I'm a student and I have, and during my sort of that day 3 and day 4, my teacher's teaching the other half of the class. So if I have needs or questions and need help, how do I get that if my teacher is teaching the other half of the class? I mean, like, how does that work? Am I only getting help 1 day a week, or so what have we kind of built in into this model to sort of around Q&A on the 2 days, again, on at least on 2 of those 3 days where the teacher's teaching the other half of the class?
Right, and that's the distinction that I made with Mrs. Mansfield's question about the 2 days are more self-directed days, and then one is facilitated by the teacher on that 5th day. But the two that are the more self-directed days, we are working with our community partners to design those essential experiences. So there will be those virtual type lessons assigned on those days. Some of that could be live, some of that could be assignments that they do. But we're building all of that right now as we speak with our community partners. That we will also, once we figure out the staffing for the K2, because nobody that I know is trying to do what we're doing here. The districts that are keeping the 6 feet social distancing, nobody is doing this K2 because it is so, you're doubling basically the coverage needed in classes and your footprint, you're doubling the number of classrooms. Once we finish the staffing of that Mary Otley Kelly with her team is working diligently on. Once they finish that scheduling and the staffing of that, we are hoping to use any remaining staff, even central office staff, to be able to support the students during their remote days, so that there's somebody watching and monitoring those virtual experiences with our essential experience partners, and they're answering questions at all time. We will always have a help desk manned every minute of the day for students who need help. We do that all the time. We do that on calamity days where we have live help lines. We also are working with some of our university partners. We have opened our doors to any field experience and student teachers, anybody who needs time. A lot of districts are shutting them all out, but we said that we could provide remote experiences for them for sure, that they could also help support the students during those self-directed remote days and supporting anything on that 5th day as well.
Thank you. Before I move on to the high school part of the model, I do want to strongly urge the folks on this call to re-examine the plan and seek to find some sort of way to include the 3rd graders in this, in that K-2 group. So that's going to be sort of my strong sort of ask and urging as the sort of the main takeaway from looking at the K-2 and 3 through 8 models. With regard, I think I've got one question left here, and then I'll cede the floor for now.
Dr. Hall,
yes.
Could I just interject here? I haven't really wanted to interrupt you. I apologize. I just wanted to underscore, because I was a co-chair on the K2 group, that our recommendation prior to recommending to you was absolutely to include that 3rd grade. That we know that's best practices. We're very concerned about 3rd graders. We did kind of got shot down in a way because of in a couple clusters, 2 clusters, it's a space issue within our buildings. And certainly, and my biggest concern was it was a staffing issue. Mm-hmm. How do we pull those 3rd graders in also with the amount of staff we currently have? Right. So I appreciate your pointing that out. And I certainly appreciate the board taking a look at any options that they would have to include that 3rd grade in there. Thank you.
Yeah, thank you. Yeah, thank you, Ms. Scheib. Yeah, again, when we're thinking about sort of our student well-being, we talk about how important these primary grades are. And I just think, again, looking at the feedback that I've gotten from parents and teachers, that the 3rd grade piece, again, that's my strong urging that we find a way. And I'm a firm believer that where there's a will, there's a way. If we get enough smart people into a room, we can find a way to innovate our way out of any problem. So I'm really looking forward to sort of continuing and really continuing that line of conversation. And thinking about sort of the high school students, one of the things, and this really could go for any grade level, but I'll keep it to the high school level. These students are getting to the end of their end of their sort of educational careers, at least with respect to sort of primary, secondary education, and we all know that there are high school students that are at a point or have reached a point that they are going to need, more than 2 days a week. I'm just being candid. And this is an urban district. This isn't Hudson, or Dublin, Ohio, where you could say 98 or 99% of your students will be just fine. They're doing just fine. They've got families that will take care of them. So for me, I'm a little skeptical and reticent to sort of wholly support a model that doesn't offer a little more choice to our high school students and parents. And so again, it's this balancing act, right? We're balancing, the health risk versus sort of the educational need. And so, but Dr. McWilliams-Woods, to your point, besides the third grade, the cacophony that I have been hearing is largely around high school. When we think about, if you contrast the K through the K through 2 group, right? These are the kids that arguably, are the least likely to follow social distancing, the least likely to keep a mask on, the least likely to cover their mouths if they sneeze, right? And yet we found a way to innovate and come up with solutions to keep these kids in school. Whereas the high school students are the ones who, in theory, are the ones who are the most likely, to keep a mask on and, be able to sort of follow simple instructions around social distancing, right? And yet we haven't afforded more choice to them as it relates to to in-person attendance. I'm not here to suggest that we should be offering all high school students in person. I'm simply suggesting that I would love to see us again, sort of really, discuss another option that would provide choice. So really look at, all right, if we gave high school students the choice, to attend 5 days a week, how many of them would choose that? So I know that we've got survey data that we've done with our parents and whatnot, and maybe we do another survey, to try and get some more information around that. But again, what I'm hearing loud and clear is that high school parents want more choice with respect to their high school students. As far as more days, whether that's,
The two options would be, we could certainly do 5 days a week for a high school. If the board decided that it would probably be 2 feet of social distance would be okay. And that's actually what Dayton City Schools is doing. They are doing 5 days a week, 2 feet of social distance, K through 12. And that we could do that tomorrow, if that's, we're recommending staying within that 6 feet of social distance, but the schools that are doing it because they're not following the recommendations from, all of these major national organizations and the scientists on the 6 feet. So we could do it that way. The other option would be that we could do the same exact model as the 3-8, and we could do 2 days a week and split the classes in half, so that half of the kids go on Monday, Wednesday, half the kids go on Tuesday, Thursday, for example. The disadvantage of that is you're actually reducing the instructional time for students. Because again, teachers are teaching content on Monday and Wednesday, and then they're repeating the same exact content to the other half of the kids coming in on Tuesday and Thursday. The high school students are actually getting 5 days a week. They're getting instruction. Some of that is site-based, some of that is remote, but they're getting a full week of instruction. So that's the trade-off. When you increase that seat time of 2 days and a set schedule, now you're actually reducing the instructional time for the high school students. And our philosophy is that the high school students, they are able to accommodate that remote learning better than any other grade level because of their maturity and because of the support that we'll be able to provide them. They will be able to come in site-based for their projects and on that set schedule. So that's why we're leaning towards that model to actually maximize the instructional time for high school students rather than almost cutting that instructional support in half with complex high school courses. These are a lot of higher level courses that students are taking even in geometry. imagine having to do that more independently, a geometry course, for example. So that's why we're leaning more towards that model. But that is obviously the board's call on that. Ultimately, whether we do reduce to 2 to 3 feet of social distance and we can bring all the students back at the high school level, or we could do the 3-8 model and have them come 2 days a week.
Thank you for that, and understood on all points. Again, salient points, you make all of them. So let me be very clear too. Like I wouldn't support a plan that was not 6 feet of social distancing. What I'm suggesting, and so let me be very clear on that, right? So what I'm suggesting is that, is there a way, as we kind of think about this, to add an extra day, to the high school program, right? Or alternatively, if we listen, we know that we've got students that need more than 2 or 3 days a week, and that might be a very small percentage of students. So the question is, looking at their performance in 11th grade or 10th grade or whatnot, how many of these students, could benefit from an extra day, or two, and so maybe we're talking about 100 kids per school that would be, that would need to be there more than 2 or 3 days based upon sort of their previous academic or current academic performance. So again, I'm sort of bringing these things up to kind of say, hey, is there a way to, to innovate our way, sort of out of some of the concerns that have been raised by folks in the community. So that would be the last question I have. Yeah. And that's the last question I have with respect to the models. Thank you.
The last comment you said is exactly what Mr. Black talked about, that for students who need it uniquely in the courses, based on the academy teacher sitting down and saying, this cohort of students, they're really struggling either with the remote or they're struggling just with the content, period. And it doesn't matter, site-based or remote, they're struggling. They can decide to have those students then come in for that additional time and that additional support. So what you just described is exactly the model that can be individualized when you don't have kind of that set, everybody comes 2 days and then you repeat the other 2 days, the exact same lessons. You can be flexible that way based on the needs of students.
Thank you.
Good, thank you. Ms. McKittrick and then Ms. Autry.
Thank you, Mr. President. In the 3 through 8 model, will there be any way for the kids on their remote learning days to listen in to the lesson again? So that if they need some clarification on certain points, there would be a way for them to connect, or I think you said pipe in, to those lessons for sort of a repeat performance. And then just a comment about, I concur with Dr. Hall about the importance of including the 3rd grade, if there's any way we can make that happen. When we talk about the importance of the 3rd grade reading test and how important, the importance that we put on that, I think we do them a disservice if there's not a way that we can include them as well. Thank you.
So we can certainly explore that value of having a Google, computer set up where we've got kids watching the repeat of the lesson. It may be difficult to pick up all the sound of the 12 kids and that type of thing to be able to pick it up, but I think we can certainly explore that individually, especially individually for students who may need that additional reinforcement. The downside of that is all the time that student is watching into that lesson, they're not advancing their learning. They're not working on the assignments and the projects that the teachers assign that are advancing their lesson, or they're not connecting into that virtual assignment in partnership with our College and Career Academy partners that is advancing their learning. So they're really, they would almost be getting half the content if they did that every week, because they're repeating the same content and they're not moving on to the new content that has been assigned to them.
I understand that. And maybe they need to listen in on every lesson again, but perhaps they're not going to be able to forward their learning if there's a concept they don't understand to begin with. Do you see what I'm saying?
Yeah.
And so maybe occasionally they would have a need to hear that lesson again. And maybe for some of our kids, maybe they will need to hear it more than once. I don't think that's beyond the realm of possibility at all.
Yeah. Yeah, I think we can explore that. There may also be an opportunity for some of our remote teachers to videotape their Google Meets and let another student, because they'll be teaching the same concept. So there may be an opportunity for someone who needs reinforcement of a lesson, because our remote teachers, that environment is easier to record a lesson and then post it for the student to get that reinforcement. So we can explore options like that.
Thank you.
Thank you, Ms. McKittrick. Ms. Autry?
Yes, thank you. And again, thank you for the team. I know this is a really, really tough decision that we are going to eventually have to make. My comments are related to high school, which is where I got a lot of calls and emails about it just because of my background. So when I think about our high schools and some of the challenges we've had already with them, there is a concern about not having enough in-person options, for the high school level. And I'm wondering if at all in the discussions it came up, evening or weekend options. And also when I think about staff members who are at risk and have concerns about being in person, do we have, has that been discussed at all, having a weekend option, evening option? When I think about my field of nursing, we have nurses who just work every weekend, and that fits their schedule, because some of our staff members have young kids as well in other districts that they're going to have to be concerned with. So that's one of my questions.
We did discuss for really all the grade levels, because when we were trying to maximize the amount of time with students, when you have half of the students, we were looking at, do we flex the schedule and go till, have one shift in the morning, by like 2 o'clock, and then we have another shift that works till 8 o'clock at night, or do we do weekends and all of that capacity? We didn't go that direction because of the expense, the logistics of our staff to try to staff that and accommodate that, because we'd have to administratively, we would have to figure out supervision for both of those shifts. It became a staffing issue on being able to accommodate more time like that. We didn't think we would be able to do it without, again, like doubling our staff. And obviously that is a difficulty for all of us because of the pandemic and the financial hit that's also happening, that we couldn't see doing it in a way that would keep our staff whole without adding staff, and being able to have the choice for our own faculty to be able to, that we wouldn't have enough staff who would say, yes, I'd like to work till 8 o'clock at night or on weekends. And we weren't in a position that we felt, both Ms. Shipe and I, to be able to force people to do that, to change to weekends or evenings because of their own family commitments.
So again, and I'm not suggesting force, I guess I'm thinking about that word flexibility that we keep tossing around, and you never really know unless you ask. It might work out very well for some staff to be able to do that. But so I'm hoping that we can be creative and just look at that again. And maybe it's just a certain course that's offered that way. My other comment, I have many, but I'm just going to end it with this one. Whatever it is that's decided, I am in favor of having some type of simulation, and I would like to participate in that simulation. And I would hope the team that created the plan would be willing to participate as well, because that would reveal a lot. And I would also say that one of the things I heard is folks wanted to give their input, and I'm just not sure how folks were picked for the surveys, the focus groups, etc. But I think there's a lot more opinions out there that we have not heard from. I know sometimes we have to move quickly But we just do not want to overlook the folks who are actually going to be sending their kids or trusting us to educate their kids. So I don't know if that's what you were referring to about the August staff prep days. But I think it would be a good idea to have some sort of simulation of what this might look like.
I actually love that idea, to be able to really walk through schedules and walk through. And I do think we're going to have such different routines that we can't design sitting outside of the schools. It has to be the faculty and the custodians and the secretaries working through all of the routines on how we're going to bring students safely through all the meal service issues, the isolating students when they do have symptoms. All of that is going to require very intensive planning and detailing, and a simulation could certainly be a part of that. Let's walk through a student's day and look at all the things that we need to take into account. And actually, Deborah Folk and our operations team members did that on paper just to start to look at some of the costs. They actually ran through a student all the way from pickup to getting them to school, just that alone. And that was very helpful and informative. So I like your idea of doing that in every school as well.
I'm sorry, this is Dr. Hall. Ms. Autry raised a point that I just want to ask a follow-up question regarding. That's the evening and weekend component. And I heard the response that some of the models we were looking at doubling our staffing. It made me ask, and maybe this has already been asked and answered in a previous meeting, but are we really trying to sort of move forward and be sort of staff neutral from a budget standpoint? Because as I think about, COVID and teachers getting sick and subs getting sick, I think it's possible, that we find ourselves running, through a lot of our teachers very, very quickly, depending upon, sort of what we see happen in our schools. And so, and also too, as you think about the evening weekend options, I know that there are no shortage of teachers. There are a lot of folks that would love to be employed as teachers with APS amongst other things. And so given the option to either not work with APS or get hired in, but you're going to work evenings and weekends for a while or rotate, I mean, perhaps, you decide to do that, in order to get into the system. So again, those are all sort of questions we can sort of kind of think through. But again, Ms. Autry sort of raised that point, and made me think about the evening staffing, and then also too about our regular staff. Are we confident we have the staffing? And are we planning to sort of have folks in the pipeline and ready to go if we see a lot of teachers get sick from COVID?
Yeah, certainly. I think the realities of having that high quality veteran staff is also that we are going to have the challenges of staff needing to either be one of the remote teachers, or we may have more of that than what we need in terms of our instructional load. If we need those additional staff, we're going to work through that. Certainly if people are sick, we will use subs. We're not going to short people if they're sick or if they need to be home because of identified COVID or having to quarantine or anything like that. Certainly we'll provide subs and have the coverage. One of the good things is we're not going to be doing massive professional development and having teachers with subs. And that typically in a district our size with around 2,000 teachers, that's about 40 subs a day that we always have available just for professional development. So we do know that we're not going to be using those on at a weekly kind of basis, so that those 40 subs can certainly be supported wherever we need it across the district.
So could I just weigh in here just quickly? Because my mind is just spinning and I do have to weigh in. So yeah. I understand that we're all also under a time pressure. August is coming, whether we like it or not. That's going to happen. I can sympathize with the board and that you're I appreciate every comment that was made about not only looking out for the safety and welfare of our students and families, but also our staff. I will tell you that AEA put out a member survey last night. It opened up on our website, and we have had enormous feedback. And I haven't gone through the survey results yet. I just glanced at them. But many of our teachers are thinking with one mind. We have a lot of tough decisions. I will say this, you know, the two ideas are in some ways opposed to each other. Bringing as many students back to the classroom in person as we possibly can, yet keeping our students and staff safe. Even talking about I don't know if you were referring, Ms. Autry, to an in-person simulation, but even something like that, exposing our staff to numerous adults causes concern in my corner. I'm happy in the next few days, in the next week or so, to share with you some of the thoughts of our teachers. But I will say this, and we represent our teachers, and I will say most of our teachers, if not all of them, certainly are concerned with their students. They're concerned with their students' education. We would all rather be back in the classroom and not even have to deal with COVID. But as you move forward, I would only ask that you continue to maintain safety and health as our number one lens, looking at that, of all of our people, because whatever happens in those buildings is going to be taken home. And that's a scary situation. And we may be smarter than ourselves, putting all this down on paper and having all these plans, and then COVID's going to rear its ugly head and make us all look like fools and put everybody back at home. So I would love to work with the board and the administration in sharing some of the feedback that we've been, the huge feedback we've been getting from our teachers as I put together this survey and the results of that, because they are highly concerned and we don't want to lose veteran teachers. We don't have enough subs. The realities of a lot of this have to be worked out. But please, please, please keep in mind the health and safety of everybody involved, students and teachers and their families in our community, because it's all going to be impacted. And a lot of it we don't know the answer to yet. And I think many of you board members have already said tonight, regardless of what we come up with, there's going to be a lot of people that don't agree with it. And either way. So it's not a great situation to be in, but I appreciate your thoughtfulness. And thank you. I'll be quiet.
One other, because we haven't talked about this, I wanted to bring up one of the other mitigation kind of strategies that we're putting in place, because even some of like the American Academy of Pediatrics, when they talked about the 3 feet of social distance, if you read the fine print in there, it says 3 feet of social distance they would support with masks, but 6 feet with adults. So no adults within 6 feet, no kid to adults within 6 feet. So there's always this nuance which reinforces the fact that the safety of our faculty and staff has to be that major focus for us. It is with our kids. We talk about our kids a lot, but we also have to talk about our staff. And so Ms. Shipe and I have talked about doing virtual staff meetings, doing virtual, if we're doing professional learning communities, doing virtual lunchrooms, or having people stay, so that the adult to adult interaction also, we have to be incredibly careful about that and make sure that we're maintaining that 6 feet of social distance and not putting people into that context that is even greater at risk than the youngest children.
Thank you. And if I could jump in, I know that the board we're all going to have to get behind a model at some point. And we're going to have to follow the science. We're going to have to follow our hearts a little bit. And as has been said multiple times, we're not going to come up with a perfect plan. We're not going to please 100% of the people with 100% of what we decide. But I think it's clear just from the questions that you all have asked so far that we're being thoughtful. I would echo Dr. Hall's sentiments and what you just followed up with. Just my personal comments here. I believe that 6 feet of social distancing at a minimum is important for the adults, for the kids, to the greatest extent possible. You've heard here tonight too the concern, not only as Pat just reiterated from what folks have said, but the concern for the students, but also for staff safety. And you had mentioned earlier some staff prep days at the beginning, and these are again just my personal thoughts as I'm weighing in. I saved a few of my comments until the end, but I know that we have several slides to get through as well still. Those staff prep days, Lisa mentioned earlier, and someone else said, we tend to Akronize everything. We are uniquely Akron. We try to do what's best for us, regardless. And so while I do want to know what's going on in other districts, and I appreciate hearing not just in our county, but from around the state and even around the country, what other districts are doing. And as some folks have pointed out to us in recent emails, even what other countries are doing, I appreciate that. But I'm also looking at Akron first and foremost and our kids. And to that being said, if those staff prep days, if we don't have enough time, if we're still trying to figure things out personally, for me, I'm telling you, I would also support those staff prep days. I would support a delayed start. I would support those remote options in the beginning or whatever that means to make sure that we're making the best decision possible. And that we're not rushing into anything because we feel the pressure of August approaching, and that's just me. That's the way I feel. But as we continue to talk about these models, I'd like that to be part of the discussion because I think it's important. And again, while August is fast approaching, I just have to say, I don't want to rush into anything. I care about our students. I care about our staff. I care about the city. I know we all do. So I'm also not suggesting that it's just me, but I'm just saying I really think it's important that we take the time to get the decision right or as right as we can. With that being said, I will be quiet. We have several other slides to get through. So please, Dr. McWilliams-Woods.
Just before I turn it over to Ms. Scheib, that is what you were describing in terms of the complexity of the decision and the weight of the decision. That is why we went out earlier than almost every district in the state of Ohio. We went out early because we were so sort of frustrated with the timing from the state that we decided we just needed to go out. I think all of the surrounding districts appreciated that because, you never want to be first. But we were really in this entire region and across our Ohio 8 districts that we wanted to go out early because the decisions were going to be so incredibly complex and needing to have these kind of rich discussions. We do have a recommendation for delaying the start for those teacher prep days. I'll just say right now, I would hope that we would make some good decisions within this next week, because once you get past that, even if we do that delay start, we still have to give time for our families to prepare. We still we're working diligently on childcare offerings, and we nail down dates with them. There's so many moving parts and pieces to this complex puzzle that the later the model decision, then we can't pull the trigger on so many other things. And so I'll just leave it there. So decision 2, I'll turn it over to Ms. Scheib.
So I think we can all agree that the whole issue about face masks is certainly a nationwide issue. And if you look at what's been happening over the last number of weeks and last number of months, we can also agree that perhaps it's become a very politicized issue rather than a health and science issue. We do know, and the data supports, that the best way for everybody to protect each other is to wear a face mask. That was our initial recommendation from you, that every body in the buildings, every student, every adult in the buildings would wear face masks, from our youngest students on up and all of our adults and educators. And that is the recommendation we're making tonight. We have not changed that. We have had conversations about the possibility of face shields being provided to our K-2 population of students. We would want you to look at the data also on that a face shield certainly does not give the same protection that a face mask would. And certainly look at the possibility of at least trying face masks, even for our youngest students, or using both face masks and face shields when needed. But we are recommending that all students and all staff wear face masks, and that should anyone have a, with the exception of medical exceptions, and those even need to be qualified as to what that is. It's our belief that if there's a student or a staff member, certainly we're providing the option of 100% online learning for students that would not want to, if they did not have a medical reason and would not want to wear a face mask, or their parents would not want them to wear a face mask, we're certainly providing them an option to work 100% online. So the recommendation is to continue to have everyone that's in the building to be wearing face masks.
And President Bravo, I think because these are shorter discussions, I think we'll go through the rest of the decision points and then have another round of questions, if that's okay with you.
Yes, thank you.
Decision number 3 is the number of students on the bus. We brought last time with you, this has shifted a little bit, that we brought 2 kind of models that showed every other seat on the bus that would get us all the way down to 11 students. And then we showed what's on the slide on the left-hand side, if every single seat, and we were getting support from the Summit County Public Health and Ohio Department of Health, that the seat itself kind of serves as that barrier. That's 22 students per bus. On the right-hand side, Summit County Public Health, and this was reinforced in separate discussions just with the district and with all of the administrators in the county, also has is approving and supporting 2 students per seat with pretty extraordinary, other safety provisions in place. So masks for all students, roof vents and windows vented to get the fresh air in the bus, hand sanitizing before they come in. There's a whole host of things that need to be in place if you're going to do that. Instead of 3 students per seat, it's 2 students in a seat. Now, we may not need that in every bus, depending on the model that you pick, but that would be the option. And if we picked that option, the implication is that if you supported having 2 students per seat with all those extensive health provisions, that we could keep the same schedules, the start time and end time for our schools as is. If we end up having to go to the 22 students per bus, we will most likely have to triple or quadruple bus routes. So we may have to have some schools, like elementary schools, start later in the day, like at 9 o'clock, like we've had to do at 400 West Market, and alter the start times to be able to accommodate that. So that is a decision point that we're going to, and our recommendation is, with all the health provisions, is the 44 students on the bus, knowing not every bus will have that maximum load. It depends, especially if you go with the models where only half of the students are going at a time. But so that's why our recommendation tonight is the 2 students per seat with the extensive health provisions in place. Mishai?
So the question as to, and it's a absolutely legitimate concern, is that because of the impact of COVID on our community, because of increased financial burden on many of our families, and the stress to make sure that their student or their child is in a uniform on a daily basis, the question has arisen, should we waive the uniform requirement for this coming school year? The feedback I've been getting from families, certainly from teachers, is that that certainly should not be a problem. We're recommending that the uniform policy be waived for the coming school year, with the provisions that, and some of the reasons that we have a uniform policy to begin with, is that we would want certainly an idea of a protocol for when a student shows up in person in class with inappropriate clothes on, and also if they show up, if we get into the colder weather with hoodies, certainly we would not want the students to have the ability to wear a hoodie over their head and have a face mask on, just so that we can be able to communicate with the students. So those minor decisions and details would have to be worked out, but we certainly are recommending that families have the option this year to send their students to school without uniforms.
And Dan Rambler has already pulled the last dress code that we had before uniforms for K-8, and taking a look at that. He'll circulate that among some teachers and principals just to get feedback, but we may be able to just kind of look at what was there in the past and bring that back just for that 1-year waiver. But we'll have that prepared for you by the next board meeting. Here's the additional staff prep days. The current is on the left-hand side, that we have 3 days of staff training and prep. And what we're proposing is that students start 1 week later. That adds additional 5 days to design those remote lessons. And the remote lessons means, for the remote teachers to do that, but also for our core teachers to be prepared for what types of assignments they're handing off to kids on those self-directed remote days, and the Friday remote days. Training on health and safety procedures and working through all those routines that'll be needed in the building to be able to keep both our staff and our students safe. And so it would literally just pick up the calendar and just go 1 week later, and we would maintain the same transition days that we have listed.
And then the procedures for health checks. Again, this is something that logistically is extremely challenging. The feedback that we've been getting on this end is that there's a concern if we do not do at minimum a temperature check at the building. I know that we've talked about the ability for possibly parents checking their student at home, teachers checking themselves at home prior to getting there. The concern obviously is if that doesn't happen, that we have either symptomatic or asymptomatic students or staff or both in the buildings. I don't know logistically. I know the considerations are there about the cost of doing that, how that would be done at, again, minimally checking temperatures on a daily basis, but that's something that I think we need more details, and we'll talk about more.
And we're preparing some different options for how some of our staff have been meeting with some vendors who have some self-check apps that could be used for that. We also, Mr. Alexander actually sent some picture and a quote for a device for temperature that they use at the courthouse. So we'll look at those options. It's not just pricing options, but it's logistically, how would we actually achieve that goal of having some kind of symptom check routine that happens as students enter the school day. So we'll have a recommendation for you next week with some options.
And also have the ability to ensure that it was done.
Yeah.
With our students. So our proposed next steps. So we're reviewing this and making or underscoring the recommendations we've already made. Currently, prior to Dr. Hall actually and several of you saying that, having the discussion about not rushing this through, but understanding that some of the decisions have to be made whether we like it or not in a certain timely manner. You have scheduled a special board meeting to finalize the reopening plans for this coming Monday or next Monday, July 20th. Certainly you'll have to talk about if that's what you want to continue to do and the time frame you want to continue following. The selection form for parents as far as selecting whether they want their student to be 100% remote or participate in a blended learning model. Those selection forms will go out July 21st, and they'll be required to have those back and make that decision by July 31st. We did speak about locking those decisions in for at least a semester, only because of space and staffing needs. So once the parents do decide one way or the other which model they wanted to follow, that would be locked in for the semester.
And you can see that if we get this information by July 31st, that gives 2 weeks for families to learn more deeply about the models. We'll have all that information posted. We'll be able to do that live chat and help desk to help them sort through and answer all their questions. We can do, video conferencing type support. Our communications team has a whole schedule mapped out on how we'll hit the ground running from that July 21st, just specifically about the models, which is why we'd like this week to go ahead and start to get out the other information on all the health things that we're doing and sanitizing and all of that. So they already have that piece. So then they're only focusing more on the school models. But after that July 31st, there's a huge amount of work because then we're going to have to do that matching of staff to here's how many remote students and here's how many face-to-face, and doing everything that you all have already described about making sure that we've got the right staff at the right grade levels here. We've got the right staff and right grade levels and content areas for the remote students. That is going to take time to sort through all of that, which is why we need that month of August, those really first 2 weeks of August, 3 weeks of August to finish all of that work. And then we can make sure that everyone knows their assignment. So that's why we're recommending this. These are our proposed next steps in terms of the flow of deadlines and information. So now we can open it up to questions.
All right, and I'll pay attention to the chat if you'd like to get in line for the questions. I will start just, you've mentioned a couple of times about special board meeting on the 20th. We don't currently have one scheduled, although there is a finance committee meeting at 4:30. Are you suggesting the 20th or the week of the 20th? And if the 20th, then we might want to get something out to the board members to make sure that folks are available.
I think ideally, and you're right, it was discussion, not necessarily a firm date. This is our proposed next step. Is there was a finance committee meeting already scheduled that maybe that could turn into a special board meeting. But obviously that's, up to you, Mr. President, in terms of how you want to schedule that.
Okay. Let's start with Dr. Akbar, then Dr. Hall, Ms. Mansfield, Ms. Autry. Dr. Akbar?
Yes. So I have a few questions, but I have a statement too. So first, I want to say that I don't think that I'll be ready to make a decision in a week from today with receiving a final report on Friday. So I would suggest that we plan to have at least 2 meetings. My other suggestion would be that we, as a board, this is my proposal, as a board, just make the decision to delay start to the middle of September to allow us time to work through this, and also give them time to work through all the details. I don't see how we can make that decision with the timeline that's laid out. And so with that, I wanted to go to something that Ms. Shipe said about students locking in or families locking into a plan and not being able to change it for the semester. I think that does work for everything. But the in-person, I think that the in-person, if you choose the in-person option, if that's 100% or what have you, the in-person option that there's there for whatever grade you're in, that there needs to be an opt-out at any point to go to 100% remote for whatever reason. I think that is, locking them into in-person is not a good practice. And so we should be flexible to have at any point someone move to remote learning. So that is one comment that I had. I have a whole lot of others, but the last thing I'll just share today is that, I think that the waiver of the uniform policy is just an example of one of those equity things that I've been talking about. And I would like for us to move away from the uniform policy altogether. It's to eventually be able to have that conversation. But I also want to be cautious of us forbidding students from having a hoodie on with their mask. I think hoodies is something that you are going to wear in the winter. And we are living in COVID realities. And so you're going to have to wear a mask, and forbidding a student from having both during this time, I think leaves us down a slope that is not going to be helpful for us. And which sends a bad message, Trayvon Martin type of message to our students. And I want to be very mindful that we do the very opposite of that. And again, I said I have a whole lot of other questions, but I'll save them. So those are the main things that I wanted to say.
If I could clarify that comment, please. I was not suggesting that they not be allowed to wear hoodies. Certainly, I believe that they should be allowed to wear hoodies. The concern from our teachers has been when they put the hood up on the hoodie and pull it close so their entire face is being covered. That's a concern from our teachers. It's certainly not that they cannot wear a hoodie to school. I think that they should have the ability to wear a hoodie to school and have in the past, certainly our secondary students. The concern with locking in on a schedule was that I think the problem logistically is from students coming from 100% remote and going to in-person classes, not the other way around. I agree with you on that one, Dr. Akbar.
Right. Thank you. And I also want to share that I don't want to be dismissive of teachers' concerns at all. I'm very pro-teacher, but I'm also very understanding of cultural realities and the way things play out. And so we really would have to, and this isn't the time for today, but we would really have to drill down what that concern comes from and where that concern comes from. And I would say that I think we should just stay away from that topic altogether, because that is problematic for it could lead to cultural and racial bias instances, and I just would stay away from it.
I 100% agree, and I think we're on the same page. I absolutely agree with you, and acknowledge that it does go to cultural and racial biases. I agree with that.
Good, thank you, Dr. Hall.
Yeah, thank you, Mr. President. So I've got questions regarding decision point, and was it 2, 3, and 6. So if you could scroll back to that second decision point around the mask, and I'll start there. So I think it was pointed out, and rightly so, that the wearing of mask has been politicized a great deal. And I think we all know where we all know where I stand on it. I think we're all on the same page that people should be wearing masks. But my question though is, we use the word recommend. And I raised this question at the last board meeting as well, where we discussed this topic point. And I think Ms. Feidel, if you're on the line, I think you were doing some research on this for us, on the legality of us trying to require, again, you know where I stand on it. But again, I can envision a scenario where people would push back, parents and/or kids, on them being required to wear a mask. So I guess my first question is, are we recommending or are we requiring?
No, this is that word is Pat Shipe and our planning team is recommending to you to require personal protective face coverings for all K-12 students and staff. So that's our recommendation to you, that we are recommending K-12 required personal face coverings, face masks for all students and staff K-12.
Okay, roger
and
that.
we believe similar to, we require uniforms in K-8, and we require specific forms that families have to provide. We require a lot in a school environment, and we see this as one more requirement that is going to keep our children and staff safe.
Yeah, roger that. So I appreciate that. And so that's where I was looking for. But again, this has the idea of mask has kind of taken on its own identity, if you will. And so that's where, to me, I just want to make sure that we're covered. Should there be some sort of pushback or legal challenge around us trying to require folks to wear a mask? Because again, the federal government has not required masks. The state has not required masks in all settings. And so as an entity that is a recipient of federal and state funds, I wonder if we have, the legal right, if you will, to require it. Again, I think we should. That's not why I'm asking my question, because I have a problem with it. I just want to make sure that if we go this route of making this recommendation, that we then don't end up, with a legal fight on our hands. And so that's where I know, Ms. Feidel, I think you'd referenced in a previous meeting that you were doing some research on this. I didn't know if you had anything that you wanted to share with regard to that this evening.
Yes, Dr. Hall, this is Ms. Feidel. I think that's something that we can certainly discuss at a later time.
Okay. Okay. Please, let's make sure that we circle back around and do that. Because I know I've asked that question at 2 successive board meetings now. So I'll pivot and go to my sort of decision point number 3. So that slide around the busing. I wanted to ask again. I mean, at full disclosure, I work in healthcare and kind of eat, drinking, and breathing this right now. And so when we say that the Suffolk County Public Health Department is supporting this particular plan, what is that support based on? Is that based upon a CDC guideline and an American Academy of Pediatrics guideline? What is that based on? And the reason why I ask that question is because what I'm really looking for is some internal consistency in sort of what we do, right? So we're talking about maintaining 6 feet in buildings, but we're not going to maintain 6 feet on school buses. I could see that kind of being a wedge issue that people would use, to sort of, create questions in the minds of certain folks in the community about why we do what we do. So I wanted to ask, like, so where does that come from? What's the underlying study or whatnot that the health department is referencing in this recommendation?
Since Mrs. Folk has been living and breathing this transportation issue and in ongoing discussions with all of our health experts, I'll let her answer that.
Good evening. How are you all? This particular recommendation, Mr. Hall, comes from the fact that if we go to try to transport the students that qualified and are eligible for transport and go from a 66 passenger bus down to 22 students per bus, which is the one on the left, then we do not have the capacity to transport most of your students to school when talking to the health department. The goal was to have students in K through 2 and pre-K be eligible to be face-to-face 5 days a week. If we do not have a full capacity on a bus, and we're not going to go there, but went down to 24 students or 22 students to a bus, then we would need 70 more buses and drivers and mechanics to get us up to, which is a 2/3 decrease. To go 1/3 below, we can make it. We can actually get most of the students to school for APS plus the 57 other locations that we are required by state mandate to consider transport between a yellow bus, a Metro bus, and other facilities. So Metro is currently requiring masks. They helped Metro write the plan, and they went ahead and helped us write it with the stipulations as written there. They felt that if we can follow these correctly, yes, it is not the social spacing that would be ideal. And to be honest with you, if you really want our students to be maxed out at as close to 6 feet as possible, then we're down to 10 students to a bus, or 11 at the max. And we were trying to make sure that parents who wanted their students in school, especially at that K-8 level, would be given the opportunity to be given the transport to the best of our ability while keeping the students and the drivers as safe as possible. So it was truly working with Summit County Health Department and putting these stipulations together that we could move this forward. And this is a recommendation to you for consideration.
And I think one of the key differences between a classroom and a bus is the air circulation that you can have, as we're reading more and more in terms of the science behind that fresh air circulation. You can accommodate that in a bus, and that can't happen as readily in a classroom setting or in a hallway or cafeteria. So I think that's a significant difference. We've also been watching carefully what's happening with our Metro buses and the safety. And you also think about the amount of time on a bus isn't as extensive as sitting all day in a classroom with a cohort of students.
So I appreciate that. And I think to that point, Dr. McWilliams-Woods, I think that's the point to lead with, right? When challenged on that, right? I mean, and I appreciate Ms. Folk's comments as well, but the way that's kind of come, the way it sounds is that we're saying, well, there's an inconvenience here, and we need to be, we need to get students to school. So we're compromising the safety first mentality to get, in order to get students to school on a bus. So that's where I think the point you made, Dr. McWilliams, I think that's the point to lead with, is the lack of time on the bus and the airflow and, and yada, yada, yada. Because again, I think that the first sort of way that we sort of addressed that made it sound like, it's inconvenient. And so we can't get students to school unless we compromise on the safety and the 6 feet, we can't get kids to school, So, and I know that's not what Ms. Volk meant, but I'm saying that, who are listening on the line, and people who are going to play this back. Some of my comments are calculated to sort of to be talking to them as well, obviously. So I think the point you made around, yeah.
And so much of this will also depend on, if we get the 10% or more students going remotely, that's also taking numbers out of our whole transportation routing. So, this recommendation would be, looking at a full bus if we needed to do that, but knowing there's a lot of factors that could reduce those numbers. We could have more families choose to drive their own children. We could have more kids doing the remote, and all of that would reduce our capacity on the buses. And then we can have more of that distance.
Gotcha. Thank you. And so moving on to my last question, which is around related to decision point number 6, procedures for health checks. So again, I know I asked some of these questions at the last board meeting as well. So apologies for being redundant in that regard. But as we sort of think through the symptom check routine, I know that I think we referenced talking to certain folks. Have we talked to Suma Health or Akron or Cleveland Clinic Akron General? Because again, because these are two health systems, that have thousands of employees. I think 7,000, I think 5,400 at Akron General Cleveland Clinic. And they are engaged in symptom checks on a day-to-day basis, in their admin buildings and hospitals and things like that. Or the county for that matter, looking at, talking to Summit County as well, right? So Ms. Mansfield, thank you for that. So again, so those might be people that I would talk to, because again, they can speak intelligently, with regard to sort of what devices they're using, and what are the best practices of trying to symptom check hundreds of people that are coming into a building all within a half an hour period of time. So again, I just would encourage us to reach out to our health systems and, i.e. in the county as well, to kind of, figure out sort of what they're doing. Again, because there's some really smart people working for those places.
We will definitely have our health team do that. So thank you.
Sure. And then as an aside, we have a local resource as we're sort of thinking about Corona in general. There's a physician at Suma, and first of all, I work there. So this is not me showing a bias, but there's a physician there, Dr. Tom File. He's an infectious disease doc there. And this physician is the president of like the National Infectious Disease. I'm not going to get the organization's name right, so I'm not going to try. But the guy is nationally known in ID, and has been sought after as it relates to COVID. He might be a person I'd be happy to put the team in contact with him as well. He might be a person that we might want to consider consulting, with respect to some of these questions. And then last but not least, the documentation component, right? So as we, and I know that this is not fully baked yet, so I get that, but as we're sort of thinking about how we clean and how we symptom check, there ought be sort of policies and procedures that sort of lay this out, with a high level of specificity. And then the question becomes, how then are we monitoring, that those plans are being followed? So we say that we're going to clean 3 times a day. Is there a log in the buildings that we're, that someone is signing to verify initially that they've done the cleaning, and then who audits that, right? So again, if you look at the retail space and take Walmart as an example, Walmart, Target, these are buildings where they've got salary members of management who have as part of their responsibility now, that their job is basically to be auditing and ensuring that the folks who say that they're doing the cleaning are actually doing it. And so again, that to me is a critical part of this. And again, it's the part of the job that is probably the one that no one really wants to do, is that tracking and compliance component. But again, if we're going to be serious and consistent about the cleaning and whatnot, and ensuring that that's happening, we've got to have in place a system where we're documenting that and double and triple checking that. So
I agree wholeheartedly. And we have talked about, this is the time where there's no corners that get cut. And the only way to really make sure is to carefully monitor and have that kind of accountability structure, and to make sure we're training folks accurately on how it needs to be done, and not thinking just a one-time training will do it. Certainly.
Yeah. And that's all I had. So thank you for the time. I appreciate it.
Thank you. And if we can, want to make a note for the record too. Mr. Alexander had to leave the meeting, but he did let me know in advance that he had a hard stop at 8:15 this evening. He is okay, of course, with us continuing. And I'm going to ask for a slightly unusual request, because we still have 3 board members that have questions and comments left to make, but we're in this unique virtual environment. I'm going to ask for a very, very brief motion, or a motion for a very brief recess. I've heard from a couple folks that need just a minute for a comfort break. So if we can please have a motion for a recess.
So moved.
Second.
Thank you. We have a motion and a second. All in favor signify by saying aye.
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 Any opposed?
I'm not opposed, but I have a point of inquiry.
Yes.
How long is this recess?
Let's call it less than 5 minutes here. Is that okay? And this is
Yeah,
from
it
your,
is.
from your fellow board members. You need just to step away from the screen for a moment, but don't want to miss part of the conversation. All right. Anyone opposed?
Sorry.
All right. Hearing none, we are going to recess. It is 7:26. We will call the meeting back out of recess at 7:31. On your mark, get set, go. All right, we are 1 minute away. Mr. Rittenhouse, are we still live, or do you want me to ask you for a heads up? Thank you so much. It is 8:31. If I could make sure that everyone has returned. See Ms. Autry, Dr. Hall. Ms. McKittrick, are you good?
I'm here.
Dr. Akbar, are you good? Thank you. And Ms. Mansfield? I'm just looking for Ms. Mansfield to join us again. All right, it looks like we are all back. Ms. Mansfield, are you good to go? All right. She is back on, so we are good to go. Thank you for being patient with us. We still have some board members who have questions and comments. We still have some items on the agenda, and we still have an executive session coming up, so we appreciate the patience. We are back in session for our regular board meeting for July 13th, 2020. For those of you watching or those of you just joining us, Ms. Mansfield, you are next in line with questions if you would like to go ahead. All right, she has messaged me. I know she is back on. Ms. Autry, would you like to go ahead and we will circle back to Ms. Mansfield?
Sure, thank you very much. And Dr. Hall actually touched upon my question regarding the health checks. But I did just want to ask, and I know you guys are still fleshing it all out. Are we anticipating possibly just expanding job descriptions, or Because it sounds to me like we're going to need like a whole department, a separate department. And I can't imagine adding anything on the plate of teachers. I mean, we're all already going to have to pitch in as far as, you know, keeping everybody safe. But to add any further duties to teachers, I don't want to see that happen. So I just wanted to know, were there any preliminary discussions about, you know, is Akron Children's Hospital, who we contract with already, are they going to help us fill the gaps with these health checks?
We certainly have had those discussions, and Ms. Shipe and I actually asked the health advisory team to start to code when, you know, we have a lot of lists that say, well, this is going to be clean and this is going to be clean. We're going to have this done and this done. And so we asked them to start coding, like, who is actually going to start doing that? And we need to start honing in on which position would make sense for the type of activity, so that we can identify gaps that we have and figure out how to close them. Certainly the health clinics, they've been working very closely with Mrs. Folk on how to receive the students who maybe are exhibiting some symptoms, how to isolate them in separate clinics that have already been identified. Like, that whole process has been worked out pretty tightly with all of our nurses and health aides that work in our schools. So I feel good about that. It's all these other areas that we're still working through to make sure that we've got who's doing what, where, and what is feasible and realistic to keep everybody safe.
So do you anticipate we're going to need a significant more staff to help with these health checks when I think about the numbers in our buildings?
Yeah, I think the day-to-day process will be able to accommodate the entry check until we know exactly how that's going to work on any kind of symptom checks that happen upon entry or during the day. I think that will decide, you know, how we're going to do that. Our goal through all of this, certainly because of the financial strain on the district, as we've been talking about finances on the other side, is to be cautious, but at the same time, we've got to be able to meet the needs of our students in terms of safety and our faculty. So we know that we keep saying all hands on deck in terms of looking at positions that maybe are in a normal stance would be doing something different, but we have to prioritize health right now. So we're not at a place where we can look at all of that yet until we get these details lined up. But we know that we're going to have to be flexible in terms of our use of staff, and our teachers need to be focused on the educating our students. So I appreciate what you said about not one more thing in terms of monitoring, but until we get that tight list, we're going to have to just kind of wait until we get that full list done and start putting positions next to it.
Thank you.
Thank you. Ms. Mansfield?
Sorry about that. I was muted and didn't realize it. So I have the grace of going after some of my brilliant colleagues who've already asked a lot of the questions that I had on my list. So thank you guys. One of the ones I wanted to emphasize was the uniform policy waiver. We were already looking at our uniform policy with our student board members last year and trying to figure out what changes we could make. So maybe this just pushes that conversation forward. So thank you, Dr. Akbar, for bringing that up. And Dr. Hall, I would also agree that it is a complicated thing to ask people to make a decision right now about whether they're going to be 100% online or not. And that I understand jumping to the classroom would be complicated, but there may be issues that come up in families or things like that. I want to make sure that we're giving them the option to opt out if things are tough. So that leaves me to two things. First, I would recommend that the health team look to or talk to the COVID teams with the county. Summit County Public Health will have information on what that entails. See if we can't get some help from the folks that are using are being put to work using CARES Act money. I know that they've been used at the courthouse, they've been used at the Akron Zoo. So I would ask that maybe they reach out and get some information on that. And then my big question would be the non-air conditioned buildings. Now, we know it's 2020, and we know for sure that somehow, some way, we're going to end up with those 90-degree days, and somehow they're going to probably last into mid-October the way we're going. So I am very concerned about our buildings, who, not just for our students and the heat that they're going to face wearing a mask and being in a non-air conditioned building, but also the health aspects with blowing fans on them that may actually, be a hazard. I'm not sure what the research is on that. And also our staff, because I know what it's like to walk from my car to the building that I'm in, and it's air conditioned, and it's so ridiculously uncomfortable on these really hot days. And a still classroom sounds like just an awful experience. And I want to make sure that we're looking at that. I know I've mentioned it to Dr. James and Dr. McWilliams-Woods, but I'd like to hear if there's any plan that can be shared with the board. Thank you.
And we also, I might add, we've talked about that. Many of those non-CLCs, or the buildings that have not been replaced yet, also are going to have issues even with the 6-foot social distancing as far as the size of their classrooms versus the size of our classrooms within CLCs.
We have a generated list of options for the buildings that Deborah Folk and the operations team are working through to see what the best option is, because we all share the concern that the buildings already are oftentimes treacherous, where we've got to have calamity days because of heat, and then you add the requirement of masks on top of that, and I think we all share that concern. So we are not at a place to give you a recommendation tonight, but know that we're going through options, crossing out which ones are impossible that we can't do, but we're looking at any ways to get relief.
Thank you, Ms. Mansfield. Any
Thank
follow-up?
you. No, thank you.
All right, Ms. McKittrick.
Thank you. With regard to number one, the school models, can you speak to that with regard to special ed, gifted and talented, and English language learners? Thank you.
For the students with disabilities, we didn't duplicate that slide again because it's the same recommendation that our students who have our most severe disabilities, and it's based on the percentage of students that are in their resource rooms. And we've got an actual that'll be on our website, kind of that differentiation of who are we talking about, because that was a question that came up. That our students with disabilities will be in that 5 with severe disabilities, primarily students served in our multi-disability classrooms and our classrooms for students with autism. Those students will be 5 days a week and a regular full day, because they're already social distanced, because the class sizes typically are below 8 students and oftentimes smaller than that. So we'll be able to accommodate them. And other students with disabilities, the IEP team will look at the models that are for their grade level and look to see how to arrange the services during that time. And for some of the grade levels, like in middle school, there may be additional time that a student could come in with intervention specialist. So that will all be worked out individually based on the needs of the students. For our gifted students, again, all those services will flow. The staff are there in the building. Once we hone in on the model, then they'll be able to work within the model to provide services to the maximum extent, either whether that's remotely or whether that's during the face-to-face time based on the schedule. We've got teams working on all of those kind of mock schedules for the models that we presented to you. And they're doing just that, like looking at all the parts and pieces that have to happen. Same thing with our English learners and the support that they get, that some of that can happen remotely, some can happen face-to-face, depending on how the schedules work out.
Thank you. That's all.
Good, thank you. Any other questions from anyone else?
Yeah, this is Dr. Hall. I actually have a couple follow-up questions I'd like to jump in with. So first, I just want to come back around full circle and kind of echo sort of what I led off with a couple hours ago now, as we enter our third hour of meeting this evening. What or where is the venue where whether it's us as the board or our senior staff, and or in concert with Ms. Shipe and her team, what venue are we going to use to sort of have the conversations around sort of teacher safety? Because candidly, we haven't talked about that much tonight. And so I'm just asking, when and where is that going to take place? Because I'd like to be a part of that. And some of the questions I've got that teachers have sent me wanting me to ask tonight on the line, that I kind of led off with around what happens to teachers that decline to return to school. Does it impact their teaching assignments? What buildings they're in? If you get sick as a teacher from COVID, can you file workman's comp? And what about the liability issues? If I'm a teacher and my husband gets sick because I give him COVID because I got exposed at school, who's paying? Or my grandfather, gets it because I exposed it to him. I mean, like how are we addressing some of these things? And what venue are these kinds of questions going to be asked and answered in? Because we're not going to talk about it tonight because we're through all the those 6 key decision points, and other questions, right? So sort of student code of conduct. I mean, I'm getting questions that are piling in on my phone right now as we're sitting here from teachers who are watching right now, asking me questions around board expectations for student code of conduct. So if a student refuses to wear a mask, what is the intended outcome? So when I say that board members are being inundated, we're being inundated. And so to me, so I guess my question in all this is not that we're going to answer all this tonight, but one more log, and that is the liability components that accompany all this. So I just want to know what venue or are we going to use to have those conversations. So that's my last remaining question, and I appreciate all the patience you all have shown in answering my questions, and because I know I've asked a lot of them. So. So thank you in advance.
All the first part of your question related to all the human resource type questions, or the and I will push back actually very heavily on your statement that we haven't been talking about faculty safety, because I feel like everything that we're talking about is involving faculty safety. If we weren't talking about faculty safety right now, we would be bringing a plan to have everybody come back with 2 feet or less social distancing. And I've said repeatedly that faculty, we need to be more concerned about faculty because they are in the age range. I am hugely concerned about our students, absolutely. But our safety for our faculty, that's why we have the plan that we have, because we're balancing both very carefully every step of the way. The second thing that you asked about, all of those human resource procedures, like with the sick leave and what happens if you quarantine, all of that. Pat Shipe and I met with Kathy McVeigh, and we started listing out all of we already have a major list of all those questions, but we really started digging into and adding some of those procedures that have to be tightly nailed down. Within our normal procedures, we have the American with Disabilities Act. There's laws that still cover a lot of that, but this is such a new area that we identified specific areas with Mrs. McVeigh that we all need to be a part of that discussion. So know that is, and Mrs. McVeigh has been working with her team diligently on trying to get all of these parts and pieces in place on how people will express their even their ability to come back to work and things like that. And the second part, you talked about student behavior. Ms. Shipe and I have a meeting on, it's either tomorrow or Wednesday, with our student behavior advisory. That's an existing advisory, and that the agenda of that meeting is to start to look at all of the other issues that we have. You know, if a student doesn't wear a mask, how are we going to handle those types of things? Some of the new things that are sort of COVID related in this time period, and how we're going to handle that.
So I appreciate your response. You know, again, you know, my comments were not calculated to be taken as we're not taking into account teacher safety. I'm just saying that, you know, me as an individual board member, I'm not satisfied yet that we talked about it enough, at least in my hearing. So maybe there have been other conversations, and that's fair, Dr. McWilliams-Woods. Maybe there have been other conversations that have taken place offline with other parties. But I'm saying in the time that we have spent in board meetings, you know, as an individual board member, you know, expressing my opinion, I could wish that we had spent more time, you know, answering or you know, talking through some of the nuances, if you will, of our faculty safety. You know, so but again, that's just my position. So certainly respect yours as well.
Thank you, Dr. Akbar.
Yes. So I have two final things. One, I think I shared this earlier about my thought around having more flexibility between our staff, not just the faculty who are teaching in the classroom, but also other staff around their choice of returning and having more flexibility with that and not forcing them to return. I think that we need to come up with some type of new procedure. So I'm wondering, my question is, has there been new procedures or processes created to ensure that our staff receive the highest consideration of flexibility of returning?
We are working on. I heard some feedback. We are, that's what I was talking about with the identification of the human resource procedures that are in place. Some of that may be captured with some of our current procedures, but we know and recognize that there's going to be additional, that Mrs. McVeigh has been capturing and starting to work on those procedures. And then, and we'll be able to bring, you know, a package together in terms of how we're going to follow those procedures. Many of them follow our typical procedures in place, but there's certainly, and that's what we identified in a meeting last week, there's some unique things that obviously we have to address.
Okay. I just want to just say again that I think that nothing about COVID is typical. And so the procedures and processes in which we put in place should be very atypical. And we should be looking at those type of innovative models that aren't just following the same typical process. You know, I shared this with the racism presentation, but this is just in general, even about just now, you know, the biggest complication we have to progress is we've always done it this way. And so I think that everything that we're doing, including these processes for our staff for flexibility, should take off the table of this is how we've always done it. And one idea that, you know, I have, so we got an email from someone who's 70 years old working for the district. That's a high risk, that's naturally known as a high risk age group. And so why should we require that person to submit any type of health condition paperwork from their doctor? We should be working with them to work out a work from home plan. And so those type of things are things we should be doing, and the burden should be on us or on the district, not on the staff members. So I just wanted to make sure I reiterated that I'm very strong on that. And then the last thing I have, which is not related to that necessarily, but it's related to something that's been in the news a lot. As we think about reopening, there's been conversations and comments by the Secretary of Education stating that all schools should reopen fully or face penalty of reduction in federal funds. And we receive a lot of our $500 million budget. A lot of that comes from federal funds, as I know everyone here knows. And I know Ryan's on the call, but have we heard anything about implications of those comments yet, and how that might factor into our district?
I'll let either our superintendent or Mr. Pendleton take that one.
I haven't heard anything, regarding that rhetoric coming from Washington. I think a lot of folks, their opinion is it may not even be legal for them to withhold those federal funds, and they actually don't go directly to school districts, they go to the state. So it's a little more complex than to just say, well, if Akron decides to stay closed and do all remote learning and not reopen for in-person, I don't know how the feds could take that money away from us when the money legally goes to the states, and the states by formula then, distributes that money to the different school districts. So we haven't heard anything else from anyone regarding that.
Thank you. Mr. Pendleton, did you want to weigh in?
No, I agree with that wholeheartedly. I've talked to ODE about this in specifics, and we have very strict rules, as you can imagine, and even adding some supplement, not supplant rules to the monies we've already received back to March 13th. So we've got to jump through some extra hoops, but we understand that there is an additional allocation of about $100 million that we're waiting to see what and how those funds are disseminated coming up. So hopefully we get a few more dollars to assist in this transition as you see how comprehensive this is going to be.
Thank you. Are there any other questions related to the presentation?
I don't have any more questions. I just have a general comment as we sort of close out. I know that a lot of work obviously has gone into this. I know I've asked a lot of passionate questions tonight. And so my only hope is that we're all, smarter than we were 3 hours ago, and trying to sort of, think through some of these issues. And I think the one thing that we all can strive to do better is communicate with each other as well as with our constituents. I've asked some questions tonight, and some of the responses I've got is, gotten is that, well, we've been working on this. We've been talking about this. And so the question I would kind of pose sort of rhetorically is, how well are we doing with sort of ensuring that those answers trickle down to our rank and file people? Because in my opinion, if they were trickling down, some of us as board members would not be getting the volume and type of questions that we're getting asked, and feeling compelled to ask, here at our board meeting. So again, I know I can do better. I know I can do better in communicating with you all, my colleagues, as well as our administration, and I will endeavor, and AEA as well. I mean, I will strive to continue to improve in that regard. But again, I just would sort of humbly ask that we all kind of, strive to do that better as we move forward.
Thank you, Dr. Hall. Anyone else? Okay, well, hearing none, thank you for the presentation and for entertaining all of the questions and comments from the board. We appreciate you taking the time to do that. Our next item on the agenda is under new business. We actually have 2 items, and I know we've spent a lot of time talking about the reopening plan. We do have normal business of the board as well, which includes superintendent and treasurer evaluations. All of you should have received and seen your email about the that I sent, sort of explaining the general process. You also received emails from the superintendent and treasurer with their most recent evaluation, as well as a blank template for your use. And just to remind you, the typical process is for each of you to use that blank template to go through that and answer the questions the best you can. You can answer some, you can answer all, you can leave comments, accolades, as well as criticisms or areas where you would like to see continued improvement. We will then collect all of those responses, and the superintendent and treasurer, because it is their evaluation, will designate who they would like to collect those responses. All of the responses from you will be compiled into one final draft copy, which will then be redistributed back to you so that you can see your comments alongside every other board member's comments. And then we will schedule a special meeting. Typically, this is done separately as a special meeting to go through and do an in-person evaluation and review of all of the comments. We'll go through typically page by page. We'll allow board members to kind of highlight certain comments that they've made on the evaluations. And so we'll get that scheduled once we start collecting the responses. I'd like to give anyone a chance to ask any questions they have about the process, and we'll do our best to answer those if you have any. Or any questions about the instruments themselves?
Yeah, I just have, oh, sorry, Diana.
We haven't set a due date, Miss Autry. Miss Autry asked when they would be due back. We wanted to get them to you first and make sure that everyone had a chance to look at them. We'll typically do that within a week or two, probably 2 weeks at this point. We need to get past the reopening. That'll give us a chance to spend some time looking at them, and feel free to reach out if you have any other questions as well, but probably about 2 weeks, I would say. Dr. Akbar?
Yes, I took a look at the evaluation, and I wondered if there was a way to update the evaluation for this year. There didn't seem to be a way of rating it on a scale, like a Likert type scale, or anything like that. It just seemed like something that you provide comments. And I think that it would be an added benefit for there to be an additional rating ability. Because right now it didn't look like there was ratings at all. And I also wasn't sure about where the categories or standards came from. So I wanted to talk through that. And also the last thing is I didn't see the goals set for last year. And so I think that it will be hard to do an evaluation without really fully knowing what the goals were set from last year. I hope all that makes sense.
Yes, and we can get you some information on the last set of goals that were set, and we'll make sure that gets out to everyone. And I'll let the superintendent and treasurer jump in. Statute sets some of the goalposts for the superintendent and treasurer evaluations. The instruments themselves, it's been a few years since we've reevaluated the actual instruments. It might not be a bad idea to add that as an agenda item for our retreat as well. We've typically brought in consultants that have assisted with that. I think Chuck Parsons, who's a former superintendent, was maybe even the last consultant that was brought in. And again, using state statutes as a goal, as a guide, and then supplementing that with how we would like the review to look built around that. But I'll let Dr. James and Mr. Pendleton jump in if they'd like to add anything.
Yeah, that's correct, Mr. President. A lot of the one document that I sent were the included the superintendent standards, which, are somewhat dated, but those are in the Ohio Revised Code, and through that Ohio Leadership Advisory Council came up with that instrument based on state superintendent evaluation standards.
Mr. Pendleton, did you want to add anything about the treasurer's evaluation?
It was jointly developed with BASA at similar times around that same set of standards. It's a process that OSBA adapted as well. I think back in the last time they updated their evaluation system was in 2019, and these model that.
Okay, and I think based on Dr. Akbar's questions, I think it might be something good for us to also add into our retreat to see if there's any room for us to take a fresh look at those evaluations, at the actual instruments. I mean, obviously, we're still basing them on standards that are in the ORC, but we can certainly, there's room to work on the instrument itself, and it has changed a little bit over time, at least since I've been on the board. So let's add that as an agenda item. Any other questions on the evaluations? If you do have any, please feel free to reach out to me or to the superintendent and treasurer directly. Again, to Ms. Autry's point, we haven't set a date yet, but we will set that now that you all have the instruments. We'll make sure, I'll look through them again. We'll make sure we send you any information on the prior goals. They should be in there. If we have to go back one more set, maybe we send yet the set that were done before that as well. And then once we start collecting them back, we'll poll everyone for dates for a special board meeting to get the in-person evaluations completed. All right, next item under new business is item 30.1, the I Promise School 2020-2021 calendar modification.
In the folder, there is a board letter. There's an MOU that was actually signed off today. We've conferred with the I Promise School for this year, and this year only. They would like to follow the calendar that the rest of the district is following. They were scheduled to return to school July 27th. Based on everything that's going on, they would like to mirror our calendar for when we start the school year, and that just for this year until we get through this whole COVID pandemic.
Thank you so much. You have the resolution under item 30.1 as well as the supporting documentation. Do we have a motion on that resolution?
So moved.
Second.
Thank you. We have a motion from Ms. McKittrick, a second by Dr. Akbar. Are there any comments, questions, or further discussion? Hearing and seeing none, roll call, please.
Mr. Bravo?
Yes.
Dr. Hall?
Aye.
Mrs. Mansfield?
Yes.
Mrs. McKittrick?
Yes.
Dr. Akbar?
Yes.
Mr. Alexander? Apologize, I understand. I believe. Ms. Autry?
Yes.
Thank you.
Thank you. And we do have a need for an executive session pursuant to Ohio Revised Code section 21.223 to meet with board legal counsel to discuss disputes involving the board and or the school district that are the subject of pending or imminent court action. Do we have a motion?
We have a motion. So moved. So moved.
Second.
Thank you. We have a motion by Ms. Autry, second by Dr. Akbar. Are there any final comments, questions, or discussion before we recess into executive session? Hearing and seeing none, the only thing I would like to say is, again, for those people that are watching this meeting, I appreciate you sticking with us. Lots of important discussion taking place, and we will return from executive session, and I do believe we have one item that we will be considering once we return. So we'll ask all of our board members to make sure to completely log out of this meeting when we do, sign into the executive session, and then we'll come back afterward. With that, we have a motion and a second. Roll call, please.
Dr. Hall?
Aye.
Mrs. Mansfield?
Yes.
Mrs. Patrick?
Yes.
Dr. Akbar?
Yes.
Ms. Autry?
Yeah.
Mr. Bravo?
All right, thank you. We are recessed and return shortly. If so, Mr. Rittenhouse, will wait for you to let us know we're okay. Thank you and welcome back to the regular session of the Akron Public School Board regular meeting for July 13th, 2020. We have one final item on the agenda, and that is a recommendation for the settlement agreement and release that is included in your board packet. Do we have a motion on that item?
So moved.
Second.
Thank you. We have a motion by Dr. Akbar, a second by Ms. McKittrick. All right. Any comments, questions, or discussion before we vote? Hearing and seeing none, roll call, please.
Dr. Hall?
Aye.
Mrs. Mansfield?
Yes.
Mrs. McKittrick?
Yes.
Dr. Akbar?
Yes.
Ms. Autry?
Yes.
Mr. Bravo?
Aye.
Thank you.
All right. Anything else to come before this board before we would adjourn? Hearing and seeing none, I would just like to say thank you to all of you for a fantastic meeting. Lots of good discussion, very good questions. Appreciate it. I know it's late. It's 9:45. We don't have these very often, but when we do, I think they're worth it. And I really appreciated hearing from all of you. So thank you. With that, we'll take a motion to adjourn.
So moved.
Thank you.
Second.
Thanks. We have a motion and a second to adjourn. All in favor signify by saying aye.
Aye.
Any opposed, same sign. We are adjourned. Thank you so much.
Thanks, everybody.
Thank you.
Thanks, everyone.
Good night.
Good night.
Good night, everyone.